Bismillahirrahmanirrahim. I welcome all the participants and all the guest speakers who are joining from US, Canada, Europe, Bangladesh, and some other parts of the world. I would like to, today's topic, I think many of you know already. This is a very sensitive topic. But before we even get in there, first of all, we'll talk about some housekeeping, which is I'm requesting everyone kindly mute your microphone to minimize the background noise so that we all can hear each other when someone is talking. If you do not, before that, this session is being recorded and will be shared in the public media. If you do not like your face to be shown on this video, kindly turn your video off. And those who are okay, you can leave your video on or off, it's up to you. When we listen to our speakers, let us not interrupt them. And what we'll do, there's a Q&A session. You can ask questions at that time. So we have about 6 speakers for today. So time is very tight, so we do not want to waste much time, but we'll go into the talks one by one. Few things, I know many of you have many different type of questions. Even though some of them are doctors, they also have questions. We are going to, like for me, I'm a non-doctor, and many people who are not doctors, and then some of the people, they are doctors. So we are going to learn from each other, clear our confusion, get good information, and avoid misinformation. That is our goal for today. I want to remind everyone that this is all our doctors are volunteers here and they do not get paid for any of this talk. And we also do not get paid for any of this talk. This is a voluntary service to our community, to our people, to our brothers, sister, family, friends, and who live with us, among us, and around us. Now, many of you will have questions. If you do not want to ask one-on-one, what you can do is there is a chat session. You can click chat and put your question in there. I will collect all those questions. I already received some text messages, some email. So I will also ask the guest speakers, all those questions, plus whatever you have, I'll collect, and then we will try to give you good information from our doctors. They open up for one-on-one question. For example, you can choose one of the guest speaker and ask him a direct question. I'll request all of you to keep it precise, question, not a discussion, more like if you have any question and you want to clear it out, just ask a question, and I'll request our guest speaker today to answer the question within 30 seconds to a minute. I know it's kind of tight, but we'll do our best. Please do your best to give the answer within that time frame so that we can address a lot of questions. Now, after that, we stop the recording, and then in Bangla, we call it Adda. In English, we call it Hangout. Then you can talk to anybody, and it could be a party, sit down and talk. So again, I'm going to repeat that this session is being recorded and will be shared in the public media. So please, if you do not want your video or face to be shown, you can turn off your video now. Now, we are affected by a disease that affects individuals in different ways. Whichever way someone gets affected, it doesn't matter, but one thing for certain is it affects your life and it spread in light speed. Let me give you some example. My family in New York, and I think many of you have many families, I'll just put one example. My family in New York, 16 members, 15 affected, 1 died. And whoever died, she was only 30 years old. She left a 4-year-old boy. And then after 4 months, after her death, she also lost her father, her mother. So this disease is very close to at least most of us, if not all of us. In California, my family, 12 people got affected. Everyone is okay now. Among distinguished guests present today, many of them got affected and they survived COVID. They are among us today. And some of us still COVID positive. They were in hospital or they came back home recently. And then some of us are not that lucky. You all know. Among us, we also have few brothers, sisters, parents, teachers, friends who are not with us today. And they took their last breath from this disease in 2020. And you know the name of this disease is nothing but COVID. Before we begin, let us pray for the departed who left us and those who are fighting COVID today and still tested positive. Some of them are in hospital. Some of them are with us today and they're positive. They're fighting COVID now. And let us pray for those who didn't get affected yet. But this is not over. Any of us can get affected and die from this or have some consequences, or some of our family members. With that, now I am requesting retired Lieutenant Colonel Mudassar Hussain Khan Bir Pratik, a freedom fighter and an exemplary human being who is with us today, to say a few words and conduct a dua session for all of us. Mudassar Bhai, please go ahead. Mudassar Bhai, are you here?
Unmute, please.
Can you hear me?
Yes, please go ahead.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Sohail, to begin, I want to ask a question. Do I have to speak in English or I can speak in Bangla? I mean,
it's up to you.
Since we said it's public, it might be open to people who do not know our language. So what do you say? But আমি স্বাচ্ছন্দ্য বোধ করি বাংলা কথা বলতে।
Please do so. Thank you.
Okay. আমি সর্বপ্রথম মহান সৃষ্টিকর্তা আল্লাহ রাব্বুল আলামিনের কাছে কৃতজ্ঞতা জানাচ্ছি আজকে আমাদেরকে এই আলোচনা সভায় যোগদানের সুযোগ দেওয়ার জন্য। আমি কৃতজ্ঞতা জানাচ্ছি particularly JCC Executive Committee এবং বিশেষ করে আজকে আমাদের সমন্বয়কারী স্টালিন সোহেলের নিকট এবং তারও বিশেষ করে আপনি আজকে আমাদের যারা চিকিৎসক যারা আছে যাদেরকে আমরা গর্বিত আমাদের দেশের সুনামধন্য চিকিৎসক যারা এখানে সময় দিচ্ছে এই কোভিডের উপরে কিছু কথা বলার জন্য সবার কাছে কৃতজ্ঞতা জানাচ্ছি। আমাকে দোয়া করতে বলা হয়েছে, আমি সানন্দ গ্রহণ করছি, কিন্তু আমি আবার সোহেলকে এবং যারা JCC কমিটি তাদেরকে আবার অনুরোধ করবো, যেটা আমি সবসময় বলে আসছি, আমাদের তো সময় প্রায় শেষের দিকে, তো আমি চাইবো যে আমাদের জুনিয়র যারা আছে তাদের মধ্যে কাদেরকে একটু এই রিকোয়েস্ট জানাতে, কারণ আমরা জানি আমরা অনেকেই যারা বয়স হয়ে গেছে আমরা অনেক সময় ছেলেদের পিছনে নাতিদের পিছনে দাঁড়িয়ে অনেক সময় আমরা নামাজ পড়ি, সুতরাং আমি সেটা খুশি হব যদি এরপরে সুযোগ দেওয়া হয় জুনিয়র যারা ক্যাডেট তাদেরকে নিকট। Sohail, can you hear me? Hello?
Yes, loud and clear. We can hear you. Please continue.
Okay. আমি দোয়া করার আগে দু চারটে কথা বলতে চাই। আমি বিশেষজ্ঞদের সেই প্রফেশনাল কথাতে যাব না, শুধু এইটা বলবো যে আমাদের চতুর্দিকে যখন এই মহামারীর থেকে আরোগ্য লাভের জন্য সুবাতাস বইছে, ভ্যাকসিন বেরিয়ে হয়ে গেছে, বিভিন্ন কোম্পানি বের করেছে, আরো বের করতে যাচ্ছে, তখন আমরা সবাই এই ভ্যাকসিনের ব্যাপারে কিছুটা উদ্বিগ্ন, অনেক দ্বিধা আছে, অনেক উৎকণ্ঠা আছে। এটার পার্শ্ব প্রতিক্রিয়ার সময় অনেক কথাবার্তা বলা হচ্ছে। সেই জন্য আমি গত যে দোয়া মাহফিলটা হলো, যেখানে আমাদের কলেজের ভুইয়া ভাইকে নিয়ে আমরা মূলত আলোচনা করেছিলাম, আরো অনেকে যারা আমাদের চলে তাদের দোয়া করেছিলাম, তখন আমি তখনকার যে মডারেটর ছিল সম্মানিত ইমদাদকে রিকোয়েস্ট করেছিলাম, আমার মাইক্রোফোনটা তখন কাজ করছিল, যে এই ভ্যাকসিনের উপরে আমাদের কিছু কথা বলা দরকার যারা বিশেষজ্ঞ আছে। তাই আই এম গ্ল্যাড আজকে এটা খুব অল্প সময়ে অ্যারেঞ্জমেন্ট করা হয়েছে। স্ট্যালিন পার্টিকুলারলি উই আর গ্রেটফুল টু ইউ এবং যারা আজকে আয়োজনে আলোচনা করছে তাদের কাছে। আর আমি যেটা শুনেছি যারা এক্সপার্ট তারা ভালো জানে যে বিশ্বব্যাপী তো এই হেজিটেন্সিটা আছেই। খোদ আমি জানি এক পরিসংখ্যানে যাক দ্বারা তারা ভালো জানবে, এক জরিপে আমি যেটা দেখেছি মোর দেন অলমোস্ট 50% অফ দ্য আমেরিকানস তারা দ্বিধাতে ভুগছে আছে এবং অনীহা প্রকাশ করেছে ভ্যাকসিন নেবার জন্য। এবং অন্যান্য উন্নত বিশ্বে একই অবস্থা, ইউরোপে তো, এবং এমনকি তৃতীয় বিশ্বে বাংলাদেশ সহ। বাংলাদেশে আমি অনেকের সাথে যোগাযোগ করেছি, ফার্মাসিউটিক্যাল কোম্পানি, ডাক্তার আলাপ করেছি, বাংলাদেশেও প্রায় একই অবস্থা। পিপল আর নট ইন্টারেস্টেড, পার্টিকুলারলি আমাদের গ্রামে গঞ্জে যারা আছে যেখানে আল্লাহর রহমতে কোভিডের প্রকোপটা দেখাই যায় না, তারা তো সম্পূর্ণ অনীহা প্রকাশ করেছে। এই অবস্থাতে যে ভ্যাকসিনের উপরে আলোচনা করাটা খুবই অপরিহার্য। তা আমি সবাইকে আবার ধন্যবাদ জানাচ্ছি আজকে আলোচনার জন্য। আরেকটা জিনিস হচ্ছে আমরা যে গত বছরটা পার করলাম, সেই বছরটা পার হয়ে নতুন বছর আসছে, আলহামদুলিল্লাহ আল্লাহর কাছে শুকরিয়া জানাচ্ছি। কিন্তু যেটা স্ট্যালিন অলরেডি বলে দিয়েছে যে গত বছরটার মধ্যে আমাদের খুব বেশি ভালো বছর যায়নি, অনেক বিয়োগন্ত ঘটনা ঘটেছে, আমরা আত্মীয়স্বজন হারিয়েছি, মহামারী সহ অনেক দুর্যোগের মধ্যে গিয়েছি। তার অনেক কিছু হতেছে আমাদের মানুষের তৈরি সৃষ্টি, কিছুটা হতেছে প্রকৃতির সৃষ্টি। কিন্তু যেটা আল্লাহ তাআলা জানিয়েছে, আমরা যারা আল্লাহর উপরে বিশ্বাস করি তাদের তো বটেই, আর যারা বিশ্বাস করি না, যারা হয়তো তো ভাবি যে নিয়তের কারণে এটা হয়েছে, তাদেরকে একটা কথা বলতে হবে যে আমাদের কর্মফলের কিছুটা এর জন্য দায়ী। আমরা অনেক দিন ধরে প্রকৃতির সাথে আমরা হতেছে যে ব্যবহারটা করা উচিত সেটা করেছি, মানুষের অপব্যবহার করেছি, আমরা নির্যাতন করেছি, অত্যাচার করেছি, দুর্বলের উপরে সবলের যে প্রয়োগ, বল প্রয়োগ সেটা করে আসছি। এটারও অনেকটা হতেছে মনে হয় প্রতিফল আজকে আমাদের। যাই হোক, আমাদের সেটার জন্য আল্লাহর কাছে দোয়া করতে হবে, দোয়া চাইবো আমার আল্লাহর কাছে। আল্লাহ পছন্দ করেন ক্ষমা চাওয়া, তওবা করা, আমরা করব। কিন্তু আমি ওই স্ট্যালিনকে আবার করে বলতেছি, আমাকে কালকে যখন স্ট্যালিন বলল মুদাসসির ভাই খুব অল্প সময়ের জন্য আপনি দোয়া করতে হবে, তখন আমি স্ট্যালিনকে বললাম একটা কথা, আমি কি শুনতে পাচ্ছ? হ্যালো,
Yes, we can hear you.
স্ট্যালিনকে বললাম, স্ট্যালিন আমরা তো চেষ্টা করছি ভ্যাকসিন সহ অন্যান্য বিভিন্ন পদক্ষেপ নিয়ে সুস্থ হবার জন্য, কিন্তু যিনি আমাদের মালিক, যিনি আমাদের সৃষ্টি করেছেন, তার কাছে যখন দোয়া চাইতে হবে তখন যদি হাত পা বেঁধে দাও খুবই অল্প সময় কথা বলতে, তারা উনি কি ভাববেন যে আমার কাছে দোয়া চাচ্ছ, আমার কাছে ক্ষমা চাচ্ছ, আমি তোমাদেরকে তোমার সবকিছু, আমি তো তোমার আলটিমেট মালিক, তো সেখানে তোমরা খুব তাড়াতাড়ি দোয়াকে চলে যাচ্ছ, এটা কেমন হয়? যাই হোক, আপনি খুব অল্প সময়ের মধ্যে কোন আলোচনাটা আল্লাহ তাআলা আমাদেরকে বুঝবেন, জানবেন, আমাদের আলোচনার মুখ্য। তবে যেই কতক্ষণ আমরা এই দোয়াটা করব, সেই সময়টা আমরা খুব কাতর হয়ে অন্তর দিয়ে কামন বাকি আল্লাহর কাছে দোয়া করব। কারণ আল্লাহ যদি আমাদের ক্ষমা না করেন, আল্লাহ যদি আমাদেরকে সুস্থ না করেন, তাহলে যতই আমরা ভ্যাকসিন দিই এখানে কোনো কাজে আসবে না। সেই জন্য তো আমরা এই দোয়াটা ওইভাবেই করব। আমি দোয়া শুরু করার আগে কোরআনের আয়াত থেকে একটা কথা বলতেছে, যেটা এখানে প্রাসঙ্গিক, সেই আয়াত নিয়ে একটু উল্লেখ করতে তারা করতেছে। প্রথম কথা হচ্ছে, মানুষের জন্ম হলে মৃত্যু হবে, এবং জন্ম মৃত্যুটা আল্লাহ তাআলা কোরআন শরীফে মেনশন করে দিয়েছেন সূরা মুলকের মধ্যে, আল্লাযী খালাকাল মাউতা ওয়াল হায়াতা লিয়াবলুয়াকুম আইয়ুকুম আহসানু আমালা। এর মানে হচ্ছে আল্লাহ তাআলা বলছে মৃত্যু এবং জন্ম সৃষ্টি করেছে এই জন্য যে দুনিয়াতে ভালো কাজ আর খারাপ কাজ যারা করে তাদের মধ্যে তফাৎ সৃষ্টি করে বিচার করার জন্য। আদারওয়াইজ ইট ডাজন্ট মেক এনি সেন্স যে ভালো মানুষ ভালো কাজ করে যাবে, তার কোনো রিওয়ার্ড হবে না, আর যে অপকর্ম করে যাবে তার কোনো পানিশমেন্ট হবে না, তাহলে তো দুনিয়ার সৃষ্টি কোনো মানে হয় না। সেই জন্য আমি মৃত্যু দিয়েছি জন্মের সাথে সাথে। সুতরাং মৃত্যুটাকে আমরা ভয় হিসেবে নেওয়া উচিত না, ইটস নট এ পানিশমেন্ট। হোয়াট ইজ ইম্পর্টেন্ট ইজ আমি দুনিয়াতে কি কাজ করে গেলাম, কি নিয়ে গেলাম, বিকজ এভরিওয়ান হ্যাজ টু ডাই, কুল্লু নাফসুন যায়কাতুল মউত, আল্লাহ তাআলা কোরআনে 7 উল্লেখ করেছেন। আর আরেকটা এখানে উল্লেখ করতে, যেটা আমরা অনেকেই জানি, আমরা সবাই রিসাইট করে অনেক সময়, সেটা সূরা বাকারা, আল্লাহ তাআলা উল্লেখ করেছেন, ওয়ালা নাবলুওয়ান্নাকুম বিশাইয়্যিন মিন খাউফি ওয়াল জুই ওয়া নাকসাম মিনাল আমওয়ালি ওয়াল আনফুসি ওয়াস সামারাত ওয়া বাশশিরিস সাবিরিন আল্লাযীনা ইযা আসাবাতহুম মুসিবা ক্বালু ইন্না লিল্লাহি ওয়া ইন্না ইলাইহি রাজিউন। এখানে মানে হচ্ছে শাসক আল্লাহ তাআলা বলছেন, মানুষকে আমি, বিশেষ করে যাদেরকে আমি পছন্দ করি, ইমানদার, তাদেরকে আমি ভয়, ক্ষুধা, ফসলহানি, রোগ, এই বিভিন্ন এবং এমনকি প্রাণ নিয়ে গিয়ে আমি তাদেরকে পরীক্ষা করি। এই কারণে আমি তাদেরকে পরীক্ষা করতে চাই, দেখতে চাই তারা আমার উপর বিশ্বাস কতখানি, আমাকে ধৈর্য ধরেন কিনা। যারা ধৈর্য ধরে তাদেরকে অবশ্যই আমি পুরস্কৃত করব, এবং পুরস্কারটা অনেক সময় তাৎক্ষণিকভাবে হয় না, বিলম্বে হয়। যেভাবে আমরা চাই সেভাবে আরো বড় আকারে আল্লাহ তাআলা পুরস্কার করে, এবং কোনো কোনো ক্ষেত্রে আল্লাহ তাআলা উপহারের জন্য আমাদের জন্য রেখে দেয়। সুতরাং আমাদের মৃত্যুকে ভয় পাওয়া উচিত না, আমাদের ভয় পেয়েছে আমাদের কর্মকে, সেইভাবে আমাদের এগিয়ে যাওয়া উচিত। আরেকটা হচ্ছে আমি এখানে উল্লেখ করতে চাই, যারা মৃত্যুবরণ করে, বিশেষ করে হতেছে যারা এই কঠিন মহামারীতে মৃত্যুবরণ করেন, অথবা অন্য কিছু কোরআন শরীফে বলা আছে, আল্লাহ রাসূল বলে গেছে কোন কোন মৃত্যুতে শহীদের দরজা পাওয়া যায়। তো বিশেষ করে এই মহামারীতে যারা চলে যায় তাদের তো আমরা উল্লেখ করেছি, এর আগে আলোচনা অনেকে উল্লেখ করেছে, তাদের হইতেছে জান্নাত আল্লাহ তাআলা উল্লেখ ইন্ডিকেশন দিয়েছে, আল্লাহ রাসূল বলে দিয়েছে। এখানে সূরা তওবা থেকে আমি একটা উল্লেখ করতেছি, সেখানে আল্লাহ তাআলা মেনশন করেছে বিসমিল্লাহির রহমানির রহিম, ইন্নাল্লাহা তারা মিনাল আনফুসিহিম ওয়া আমওয়ালিহিম বিআন্না লাহুমুল জান্নাহ। আল্লাহ তাআলা বলছেন কত বড় আল্লাহ তাআলা নির্ভর, কত আল্লাহ তাআলা মহান এবং রহমান রহিম। আল্লাহ তাআলা বলছে যে আমি মানুষকে যারা ঈমানদার তাদের আমি জীবন প্রাণ কিনে নেই জান্নাতের বিনিময়ে। I purchase the life, the soul of those righteous people in exchange of Jannah. So আমাদের এটা মনে রাখলে এই কোভিড নিয়ে মৃত্যু নিয়ে আমাদের ভয় পাওয়া উচিত না। আরেকটা হচ্ছে লাস্ট কথা আমি কোরআন থেকে উল্লেখ করি, দোয়াতে চলে যাব, সেটা হচ্ছে সূরাতুল জুমারে আল্লাহ তাআলা উল্লেখ করেছেন কত বড় মেহেরবান, এটা পড়লে আমার গা শিউরে ওঠে। আল্লাহ তাআলা বলেছেন কুল ইয়া ইবাদিয়াল্লাযিনা আসরাফু আলা আনফুসিহিম লা তাকনাতু মির রাহমাতিল্লাহ ইন্নাল্লাহা ইয়াগফিরুয যুনুবা জামিআ ইন্নাহু হুয়াল গফুরুর রহিম। আল্লাহ তাআলা বলছে মানুষকে উদ্দেশ্য করে, হে বান্দা, হে মানুষ, তোমরা যদি পাপের মধ্যে ডুবে যাও, ডুবন্ত অবস্থা থাকো, পাহাড় সমান যদি পাপ করে থাকো, তবু আমার রহমত থেকে তোমরা নিরাশ হয়েও না। আমি তোমাদেরকে ওয়াদা করছি, তোমরা শুধু আমার কাছে তওবা করো, অনুতপ্ত হয়ে ক্ষমা চাও, আমি তোমাদের জীবনের সমস্ত গুনাহ মাফ করে দেব, কারণ আমি তো গফুর রহিম। শুধু আমাদের ভয় পাওয়ার কোনো কারণ নেই। আল্লাহর রহমান, আল্লাহর রহমত অনেক বেশি, অনেক বেশি। আল্লাহ তাআলা পুরো রহমতের 99% নিজে হাতে রেখেছে, 1% আল্লাহ ডিস্ট্রিবিউট করেছেন সমস্ত প্রাণীকুলের মাধ্যমে। আমরা চাইলে আল্লাহ তাআলা এই 19% আমাদেরকে রহমত দিবেন। সুতরাং সেইভাবে আমাদের এগিয়ে যাওয়া যেহেতু আমরা চেষ্টা করব আরোগ্যের জন্য, ভ্যাকসিনও যে কোনো, কিন্তু সবশেষ কথা হতেছে আল্লাহর কাছে আমাদের ক্ষমা প্রার্থনা করব, আল্লাহর কাছে সাহায্য চাইতে হবে। সেইভাবে আমরা আসুন আমরা আজকে সেইভাবে আল্লাহর কাছে মিনতি করি, চোখের পানি ফেলি, এবং আল্লাহ তাআলা ওয়াদা ভক্ত বান্দা যখন চোখের পানি ফেলেন তখন আমি তাবু কবুল করি। আর তাছাড়া আমাদের সাথে ফেরেশতা যোগদান করে আল্লাহর কাছে আমাদের হয়ে আমিন আমিন বলে, যখন আল্লাহর কাছে চোখ ফেলে আল্লাহর কাছে আমরা প্রার্থনা করি। আমরা সেইভাবে আজকে আল্লাহর কাছে হাত তুলে আল্লাহর কাছে আমরা চোখের পানি ফেলি, আর্তনাদ করি, যারা চলে গেছেন তাদের জন্য, এবং যারা জীবিত আছেন অসুস্থ তাদের জন্য, সমস্ত মানব কুলের জন্য, মানব জাতির জন্য। আল্লাহুম্মা আমিন। ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وادخلنا الجنة مع الأبرار يا عزيز يا غفور رب العالمين. ربنا لا تؤاخذنا إن نسينا وأخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. ربنا تقبلنا منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم. اللهم اغفر لي ولوالدي وللمؤمنين والمؤمنات والجميع المسلمين والمسلمات الأحياء منهم والأموات إنك مجيب الدعوات. يا الله الرحمن الرحيم مالك قدوس السلام المؤمن وهيمن عزيز الجبار متكبر يا خالق الباري مصور غفار قهار وهاب رزاق فتوى للقابض باسط خافض رفيع معز يا مذل السميع بصير الحكم يا لطف اللطيف الخبير يا حليم يا عظيم يا غفور شكور يا علي كبير يا حفيظ مقيت حسيب جليل كريم رقيب مجيب يسير حكيم ودود مجيد وعيس شهيد حق يا وكيل الكبير متين ولي حميدي مخزي مقدي معيدي محي مميت حي قيوم واجد ماجد واحد احد يا السمد يا قادر مقتدر مقدم مؤخر واول واخر ظاهر باطن ولي متعالي بات يا توام منم منتقم عوف راف مالك الملك يا ذا الجلال والاكرام يا رب يا مقصد جامع غني مغني موتي ماني زري نافي نور يا هادي بقي ولي صبور صادق ستار يا الله الرحمن الرحيم الله আমরা কিছু গুনাহগার বান্দা তোমার দরবারে আজকে হাজির হয়েছি আল্লাহ তুমি আমাদের হাতগুলি কবুল করে নিও আল্লাহ তুমি মালিক তুমি সৃষ্টিকর্তা আল্লাহ তুমি ক্ষমা না করলে আমরা কার কাছে যাব আল্লাহ যা কিছু আল্লাহ তোমাকে স্মরণ করে তোমার কালাম পাঠ থেকে আল্লাহ উচ্চারণ করেছি তোমার হাবিবের দুরূদ পাঠ করেছি তোমার পবিত্র প্রশংসার নামগুলো উচ্চারণ করছি আল্লাহ এর ভুল তিনি মাফ করে তোমার দরবারে কবুল করিও আল্লাহ আমাদের ইবাদত আমলে নেক আমলে ফজিলত তোমার হাবিব নবী করিম সাল্লাল্লাহু আলাইহি সাল্লামের পবিত্র রাজ মুবারক পবিত্র আত্মার পৌঁছে দিও আল্লাহ আল্লাহ তাআলা সাহাবায়ে কিরাম আত্মীয়স্বজনের পাক আত্মার পৌঁছে দিও যত পয়গম্বর নবী রাসূল পৃথিবীতে আসিয়াছেন পীর আউলিয়া গাউস কুতুব ফকির আম্বিয়া কিরাম মুমিন মুমিনা শহীদান সালেহান সবার আত্মার পৌঁছে দিও আল্লাহ খাস করে আমাদের আত্মীয় বাবা মা দাদা দাদি নানানি সুসমানদের ভাই বোন মুসলমান ভাই বোন যে যেখানে কবরে সে সমস্ত পৃথিবী যাদের কবরে সবার আত্মার পৌঁছে দিও সবার গুনাহ মাফ করে দিও কবরে আযাব থেকে রক্ষা করো আল্লাহ জান্নাতবাসী করে দিও আল্লাহ খাস করে আজকে আমরা হাজির হয়েছি এই মহামারী কোভিড আক্রান্ত হয়ে যারা মারা গেছে তাদের আত্মা পৌঁছে দিও তাদের কবরকে জান্নাতে বাগানে পরিণত জান্নাতে ফেরদৌস নসিব করে দিও আল্লাহ হে আল্লাহ তার সাথে সাথে যারা কোভিডে আক্রান্ত হয়ে আছে আল্লাহ যারা হাসপাতালে ভুগছে বিভিন্ন পরিবারের বাসায় তারা ভুগছে তাদেরকে সুস্থ করে দিও আল্লাহ আল্লাহ আমরা চেষ্টা করছি আমরা তোমার দেওয়ার নামত দিয়ে আমরা ভ্যাকসিন ওষুধ দিয়ে নিজেদেরকে আরেকটু আল্লাহ লাভ করার জন্য কিন্তু তুমি তো রহমান রহিম তুমি মালিক তুমি না চাইলে আমরা কখনো সুস্থ হতে পারবো না আল্লাহ আমরা গুনাহ করেছি আল্লাহ আমরা জানি আমরা অনেক পাপ করেছি কবিরের শিকারে করেছি তুমি তো রহমান রহিম তুমি তো গফুর রহিম তুমি তো বলেছো লা তাকনু মির রাহমাতুল্লাহ তুমি আমাদেরকে সাহায্য না করলে আমরা কার কাছে যাব আল্লাহ তুমি ক্ষমা করতে পছন্দ করো তুমি তওবাকারীদের পছন্দ করো আমরা তওবা করছি আল্লাহ তুমি আমাদের তওবা কবুল করে নিও আল্লাহ আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি লা হাওলা ওয়া লা কুওয়াতা ইল্লা বিল্লাহিল আলিয়্যিল আযীম আল্লাহ তুমি আমাদের তওবা কবুল করে নিও আল্লাহ তুমি রহমানি গফুর আল্লাহ তুমি তওবা কবুল না করলে আমরা কার কাছে যাব তুমি বলেছো বান্দা যখন হাত তুলে চোখের পানি ফেলে তুমি তা কবুল করে নিও আল্লাহ আমাদের প্রার্থনা কবুল করে নিও আল্লাহ আমরা তোমার পথে যাতে চলতে পারি সেই তৌফিক দিও আল্লাহ আমাদের অসুস্থতা দূর করে দিও আল্লাহ হাত বিনতে করে তোমার কাছে অসুস্থতা আল্লাহ দূর করতে চাচ্ছি হাত চাচ্ছি আপনাদের তোমার পথে চলে তোমার ইবাদত করে তোমার আদেশ পালন করে আপনার চলার জন্য সেই তৌফিক তুমি আমাদেরকে দিও আল্লাহ আল্লাহ আমাদের মধ্যে অনেকে তোমার ক্ষেত্রে নেক বান্দা অনেকে আল্লাহ তোমার পবিত্র ঘরে হজ আদায় করেছে আমরা যারা হজ আদায় করেছে তাদের মধ্যে যারা এইখানে তোমার নেক বান্দা তাদের হাতগুলির মাধ্যমে আমাদের সবার হাতগুলি কবুল করে নিও আল্লাহ আমাদেরকে ফিরে দিও না সুস্থতা দিও আল্লাহ তোমার কাছে আবার প্রার্থনা করছে যারা আমাদের আত্মীয় স্বজন ভাই বোন যে যেখানে আল্লাহ মারা গেছে তাদের আল্লাহ গুনাহ মাফ করে দিও জান্নাতবাসী করে দিও আল্লাহ যারা অসুস্থ আছি তোমাদের সুস্থতা দিয়ে দিও আল্লাহ আল্লাহ সমস্ত বিশ্বের মুসলমান সমস্ত মানব জাতিকে তুমি এই মহামারী থেকে আমরা মুক্ত করে দিও আল্লাহ আমরা ভুল করছি তুমি আমাদেরকে তোমার পথে ফিরে নিয়ে এসে তোমার পথে চলার তৌফিক দিও আল্লাহ কবুল করে দেওয়ার প্রার্থনা আল্লাহ ফিরে দিন আল্লাহ আল্লাহ কবুল করে নিও আল্লাহ আল্লাহুম্মা গফিরলি হাইয়ানা মাইয়ানা শাহিদানা গাবিনা সাগীরানা কাবীরানা যাকারুন সাদা اللهم من أحياك منا فعلى الإسلام ومن منا فتوفى على الإيمان اللهم إنا نسألك الجنة ونعوذ بك من النار يا خالق الجنة والنار برحمتك يا عزيز يا غفار يا كريم يا ستار يا رحيم يا جبار يا خالق البال اللهم أجيرنا من النار اللهم أجيرنا من النار اللهم أجيرنا من النار يا مجيد يا مجيد مجيد سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وجعل آخر كلمة عند الموت لا إله إلا الله محمد رسول الله صلى الله عليه وسلم. Thank you, Sohail. Over to you.
Thank you, Mudassir bhai. এখন আমরা let's go back to the program. Mudassir bhai আমাদের সবার জন্য দোয়া করার জন্য সবাই একসাথে দোয়া করলাম অনেক ধন্যবাদ Let me give you a quick statistics about what are the numbers in affected versus the dead. So worldwide, 89.5 million affected, 1.9 million dead. New York, 1.2 million affected, more than 39,000 dead. California, about 2.7 million affected, more than 29,000 dead. Texas, almost 2 million affected, more than 30,000 people dead. USA alone, 22.2 million affected, 372,000 dead, and which is 20% of the whole world. So the death rate is about 1.6%, and it might seem very low for many, but let's keep it in mind that if this rate continues, our death toll would be over 5 million just in USA if we cannot protect ourselves. Now, there's some good news. As we know, the cure is not there. I think people, the doctors, scientists do not know exactly how to handle this COVID situation, but there's a good news from the scientific community, which is we have vaccine. And thanks to our scientific community for that very fast vaccine that we got. Through their hard work, we have a partial solution to this problem. Our discussion today is around COVID vaccine. We have distinguished doctors present here today. We'll hear from them one by one. We'll get to know type of vaccine, information, misinformation, global and domestic challenges, side effects, long COVID, type of organs it's going to affect or affecting, who got COVID, how can we be more careful, proactive, how can we treat it at home. So we have a long list of program, and we have a lot of doctors that are present here today. This program, I want to remind you, is being recorded and it will be shared in the public media. Also, this program is for information purpose only. Before taking any action, kindly consult your own physician. We are doing our best to give you a lot of good information, and that's our purpose. With that, let me introduce one of the guest speaker for today, Dr. Abu Said Firoz from Fort Myers, Florida. His specialty is and board certification in internal medicine, pulmonary lung disease, critical care, sleep medicine. Dr. Firoz attended JCC, Engineer Cadet College, graduated from Dhaka Medical College, and completed his residency and fellowship training in New York before moving to Fort Myers in 1990. He has been in private practice for the last 30 years. He and his wife, blessed with 2 daughters, married and living in Boston and Hershey, Pennsylvania. In the spare time, he enjoys traveling, fishing, playing tennis, keep up to date with the current medical literature. Dr. Firoz and his wife have been living in Fort Myers, Florida for the last 30 years. He cordially invites Jessica family to visit them when visiting Florida. With that said, I would like to welcome Dr. Firoz in our session today, and I will humbly request to start his session now. Thank you. Please go ahead, Dr. Firoz.
Sohail, can you hear me?
Yes, I can hear you. Please go ahead.
Okay. আমি শুরু করার আগে I like to thank Mudassir Bhai for his excellent dua, as he always does. But I just want to mention, আমি একটা দুটো কথা বলতে চাই। আমার তো বয়স হয়েছে, আমি ব্লাড প্রেশারের ওষুধ খাই। তো ওষুধটা খাওয়ার আগে আমি বলি আল্লাহু শাফি, that cure comes from Allah, not the medicine. Allahu kafi. And Allah, kafi means, he has power and he'll take care of everything. And the other thing is, all of us have to die. Understand this, and Allah knows what is best for us. So one important thing is Hasbunallah wa ni'mal wakeel. Allah knows what is best for us, He knows how long we need to stay here and when we need to go. So understanding all this, cure comes from Allah, medicine is just, but I was just amazed with the Mudassir bhai jete boleche, a lot of people don't want to take the vaccine, they are doubting the vaccine. Understand this, that Allah has given us knowledge. And the medicine, was the Pfizer, the vaccine which first came in, it came through the brain and knowledge that Allah gave to Muslims, So he has given a disease, he has given a cure, and he has used the Muslims, for the humanity. So I don't want to spend too much time about it. So what we are going to talk today is not about the entire COVID-19. The COVID-19 has been there for almost 1 year with us, So most of us know. So today we are going to touch on two important topics on COVID-19. One will be applicable to the United States mostly, where the monoclonal antibodies are available. And the second part is the vaccine, which will be applicable worldwide. Now, the title of the talk, our experts, I'm not an expert, I do not provide any suggestions or anything without a randomized controlled trial. And the other portion of the thing which was mentioned in this is to avoid misinformation. We are morally and ethically, it is important, incumbent on the physicians not to give his own judgment. If you are not doing a randomized controlled trial, you cannot give a judgment, You have to follow the guidelines. While I've been working in ICU and taken care of more patients, intubating them, putting them on the ventilator, putting dialysis catheter, taking care of these patients, I have not published data. I do not have randomized controlled trial. Hence, I cannot tell that I'm an expert, and this is what I think it should be. In this country, we follow randomized controlled trial and guidelines, and we have to follow that. The reason why I'm telling this is too many times, outside the United States, people do things, that they think is good, and sometimes it is not good. I'll give you a quick thing, the immune modulators, there are some medications, which stops the immune system, and it helps in COVID-19, causes secondary infections, which a lot of the doctors don't understand, and they use it indiscriminately. One of my classmates, sister and brother-in-law is admitted to a hospital in New York. They went to the doctor in New York, and both of them were given corticosteroids. And his wife is doing very well. She's at home and she's taking corticosteroids. It's contraindicated because the corticosteroids, cause viral replication, prolongs the disease, and may have a negative outcome, as was proven in the recovery trial in England. So our important thing is not to pass our own judgment. Please don't. Go by the randomized control trial, and then, so I'm going to move on quickly, because this is what I've been working the last 30 years, and I work mostly in the intensive care unit, taking care of sick patients, and our hospital is again full with COVID-19 patients. I hope you can hear me all. Can you hear me? Hello?
আমরা তো মিউট করা আছে আমাদের তো
Okay.
Yes, we can hear you. Yes, we can hear you. We can hear you loud and clear. Please go ahead.
Okay, so Sohail, if you can interrupt me if you don't hear me, I know I had a little bit problem with the microphone. This is the old slide, Now this SARS-CoV-2 is what is called a beta coronavirus. We have seen the coronaviruses before, and if you all remember, we had the SARS-CoV-1, which was a very bad disease with a very high mortality. But we are fortunate that, the disease died down. And then we had this in the Middle Eastern respiratory syndrome. That was a very high mortality rate, about 34.38%. And now we have the SARS-CoV-2. This was on March 27, but Sohail already gave you an update as to what populations are infected in the world, the numbers and all. And this is what a coronavirus looks like, and what we are all concentrating on the proteins, especially the spike proteins. And that will be important when I talk about the vaccine. So if you look at the coronavirus, SARS-CoV-2, these are all the proteins that are there against which we are trying to manufacture vaccine. But we have almost entirely concentrated on the spike protein here, the spike protein. But there are other proteins which are called, which are in the membrane. And then there's the membrane glycoprotein. There's also an envelope protein, and there's a messenger RNA. So this will become relevant when we talk about the vaccine development and how we take care of things. Now, this one slide, I want you to understand something. I will give you an example that a lot of people get pneumonia, a urine infection, and some people die, and some people get better. Now, why some people die and why some people get better? We use a medical term called sepsis, S-E-P-S-I-S, sepsis. And the medical definition for sepsis is dysregulated humoral response. So when you get an infection, in the body tries to fight the infection. And most of the time, what will happen, the body will mount a regulated, balanced response. Now, when that shifts from the balanced, regulated response to a dysregulated, we use a term called dysregulated response or hyper response. When the body does this dysregulated response, you die. It is not the COVID-19 that is killing you. It is your body's inflammation and hyperreaction and dysregulation that is killing you. So this is a slide which says the different stages of COVID. You start getting the virus, see how much lot of virus you have in your body. So a lot of virus, it eventually fades away if you don't do the wrong thing. Suppose if you give here corticosteroids, steroids here, then this will go on and on and on, the virus. You don't want to give corticosteroids. Now, if you follow this dark black line, the body is trying to mount a response, trying to fight the COVID. So this one, if you look at here in the second stage and third stage, this is dangerous. This is when, if this black line was like a straight line which plateaued here, that would be a regulated response. This is what is called a dysregulated response. The hyperreaction, hyperinflammation, and this is what you die of COVID really. The body, you don't die really of COVID, you really die of the hyperinflammation and the secondary consequences of that. So going back to the timing and the goals of COVID-19 here, pre-exposure, what can you do? Suppose somebody is at a home who got COVID. So now this disease is such, if one person gets it at home, everybody is going to get it. There's no way around it. What can you do to prevent it? I will only quote the randomized control trial. I'm not an expert. I'm not going to give an expert opinion. There is no medication which works for the pre-exposure prophylaxis, according to the guidelines in the United States. And then we get an incubation period here. It is about a week, 2 to 5 days. And then you get the acute phase of the response, the initial phase. So what happens here, you get a cold, runny nose and all. Now, this part is very important, especially for those in the United States. You must know about this because God forbid, if you get a COVID here in the United States, now we have the monoclonal antibodies. These are manufactured by 2 companies. I'll tell you the companies. I won't tell you the drug name because they're very cumbersome. One is Lilly. Lilly company manufactured a monoclonal antibody. And then Regeneron, they also manufactured an antibody. So that if you're feeling sick, and this can be given only in the first 7 days. So the best thing for you guys, in the United States is go to the emergency room and tell, I think I have COVID because my wife has COVID at home and I think I have it. So they must do a PCR testing and show you have COVID. If you have COVID, you can tell them that, can I get the monoclonal antibodies? Can I please get the monoclonal antibodies? Now, there is a guidelines, you have to be above 65, or if you're below 65, then you have to have risk factors, which I'll talk about a little later. And then it has been shown that if you got the monoclonal antibodies in the early phase, your risk of death, hospitalization, or emergency room visit decreases. The monoclonal antibody have also been tried in the hospitalized patient, and it doesn't work, you know. Then we progress to the more severe phase where you end up on the ventilator and all. You know, to date, we don't know of any medications that has worked very well. And this is where the body is reacting tremendously. That you remember the dysregulated and hyper response, that's what's happening here. And the only thing that has worked so far based on the RCT is a randomized control trial. The recovery trial from England is a steroid called dexamethasone at a limited dose and limited time, 6 milligrams, not more than that. If you give too much of steroids, you'll have viral replication, the virus will multiply, and it will shut off your immune system, you know, and you'll get secondary infection. So I will proceed. Now, one thing here, which is important, you know, COVID-19 affects every organs in the body. The reason why you die in the hospital is because of two things. One is the lungs here. When the lungs get infected and inflamed, you stop breathing. And the second is blood clot. You know, these are the two things why you die in the hospital. Now, long term, you know, there are other things that can happen, and Rizal is here. He may touch a little bit about the cardiac thing that happens in COVID-19. And Daud is here. He can talk a little bit about the kidney thing. And so these are all the organs that can be affected in the long-term COVID and the neurologic involvement and all this. You know, Akhtar will be able to talk a little bit about that. Now, this is from the CDC. Now, this is here, not hospital, mild, moderate, and this is a mild disease, you know, non-hospitalized patient. The take-home message is that do not use dexamethasone. If your doctor has given you, as I found out this morning, you know, that, you know, somebody is at home, the doctor in New York gave dexamethasone, I asked him to stop it because it causes viral replication. And it has been shown that there is increased mortality if you give dexamethasone steroid at this stage. For those in the United States, you must, if you have risk factors, if you have diabetes, if you are overweight, if you have renal failure, or if you are above 65, when you go to the emergency room, they say, oh no, you're too good, I'm sending you home. You should ask them that, do I qualify for the monoclonal antibody? These are the names. This is the bamlanivimab, caricimab, and lindevimab. But you say the Lilly or the Regeneron. So this is good for, and it works. It decreases your disease progression. It decreases your emergency room visit, and it decreases death. So this is the early stage when you're not hospitalized. Now, as you get hospitalized, you know, in the early phases, you know, there was a release for the remdesivir, you know, to use. This is an antiviral medication. So, you know, those were given remdesivir. But still, when we get the patient in the hospital and the patient has COVID and the oxygen saturation is low, we do not use dexamethasone. Dexamethasone should only be used with the oxygen saturation. Dexamethasone is a steroid. And then hospitalized patients who have oxygen is dropping, you're needing high flow oxygen, or you are in a ventilator, or what we call BiPAP, you know. So at that point, you can use the steroids and remdesivir, you know. And then subsequently, you know, it says that, and when patients are already intubated with renal failure and all, you know, the only medication that has been shown to change mortality is the steroid dexamethasone. Now, understand this, you know, monoclonal antibody, remdesivir antivirals are only useful when you give it early. If you give it late, it doesn't work. Now, just for a little bit of understanding, when you get a COVID infection, the body tries to fight it out. And we have two ways of doing it. One, these cells are called the B cells, and the plasma cells. They manufacture antibody and they bind to the COVID-19, and so it cannot cause problem. So most of the vaccines and all our therapy is related to this antibody. Our killer cells, you know, killer T cells, we have it, and they also form part of the immune system. Now, when you get an infection, you manufacture the COVID virus is in your body, and you manufacture antibody, and then you get immune. How long this immunity lasts, we don't know. anywhere between 4 to 8 months, we still don't know. Now, infected patient, manufactured antibody got better. Normal person just got COVID. Somebody else at home has COVID, does not have any antibody. See, this is the point of giving the monoclonal antibody, neutralizing antibody. Or, we have also used COVID convalescent plasma from people, and those we do in the hospitalized patient. Now, what are monoclonal antibodies? Monoclonal antibodies has changed the whole game of treatment in the world. You can't believe, especially in cancer, I have seen patients, who have multiple chemotherapy didn't do well. And with the monoclonal antibody, they're all getting better. It is also used in other diseases like rheumatoid arthritis, and collagen vascular disease. So basically what it is, these are antibodies manufactured outside the body. So what happens is there are two ways you can do it. I can show you in the next slide. One is called a mouse monoclonal antibody. Another is called the human monoclonal antibody. So what happens is you can inject the mouse with the antigen, which is COVID-19, and the mouse manufactures antibody. Now, you remember the B cells, I told you, the B cells and plasma cells. So the B cells manufacture the antibody. Now, you take this mouse is humanized, the genetic material have been changed to show that it is mostly the human thing. And then once these B cells are taken out of the body, they are cloned to manufacture, a lot of antibodies, which we sell commercially as monoclonal antibodies. And then you can get the human monoclonal antibodies also. So instead of giving the plasma that we were doing before, COVID convalescent plasma, we have now manufactured it in the laboratory, the monoclonal antibodies from the B cells, which are also useful now. So basically it is, this monoclonal antibodies, the Lilly has it, the Regeneron has it, so if any of us get sick, and go to the hospital, we can demand that we want the monoclonal antibody. It does make a difference. These are the risk factors. If you are overweight, your BMI is more than 35, you have kidney disease, diabetes, then you can demand, that you want the thing.
Yeah, hi.
So the key thing to remember, the earlier it is better, and now just quickly moving on to the vaccine. But before I do that, can I ask Sohail to go ahead and put that, we had some questions for the audience regarding the COVID-19 and how it has affected your family and all. Sohail, would you like to do it at this time?
First, thank you. Thank you. Please please continue on because I have some issues with the polling. So
okay,
I'll try to see. Just go ahead and you can finish whenever you're ready, and then let me know.
Or you can interrupt me if you want to. So moving quickly back to the vaccine, I think we have a speaker also will talk more about the vaccine. So this is just the basic concept, how we are doing vaccines. And so there are different kinds of vaccines. The one we have in the United States are called the genetic vaccines. Genetic vaccines are, you take the spike protein, you know the genetic sequence, and then all these vaccines are the genetic sequence of the spike protein. It is not the virus that you're injecting. You are injecting the genetic sequence of the spike protein and allowing the body to manufacture the antibodies. So the next thing is that this is purely, this type of technology was never used before. It's the genetic vaccine. This is the first time in our knowledge that we have used the genetic vaccine. Then inactivated viral vaccines, the Oxford vaccine, AstraZeneca, what they do here, they use a vector. In the Oxford virus, they have used the chimpanzee adenovirus. So this is a non-replicating virus. What they have done is taken the genetic material and put into the chimpanzee virus. So this is a non-replicating virus, but it can stimulate the body continuously, with the genetic material to produce antibodies. So there are also other vaccines. So I'll be talking a little bit later, to tell you, which uses this inactivated viral vectors. And then you can take the viral protein, with adjuvant. And then in India and China and all, they have taken the whole virus, inactivated it, and injecting to produce the antibodies. Now, this is a little older slide, to tell you, so we have these genetic vaccines, RNA, DNA, the Moderna and the BioNTech, which is available here. The viral vector vaccines, the Oxford one is available now. It's called chimpanzee adenovirus Oxford 1. And then we have the protein-based vaccine here, which is the Novavax, which has not been released yet, but will be coming soon. And the whole virus vaccine, the Sinovac and the Bharat Biotech. This should be available in Bangladesh. These are the whole virus vaccine. And the repurposed vaccine, this was already stopped. They're not doing it anymore. So authorized recommendation in the United States are the Pfizer BioNTech COVID-19 vaccine and the Moderna vaccine. So this is a genetic vaccine. And those are in clinical trial. This has already been AstraZeneca. Remember, this is a viral vector. It's chimpanzee virus, where the genetic material have been put to a non-replicating, non-multiplying chimpanzee virus to produce continuous stimulus to the body to manufacture antibody. And Janssen is another one which has used the adenovirus, Janssen, and this is manufactured by Johnson & Johnson. So this is also an adenovirus, and the Novavax virus is the protein thing. So we'll talk about that a little later. And so the Oxford vaccine, this has been approved in the United Kingdom. The Novavax is not yet available in the market. The Johnson & Johnson, the Johnson & Johnson is the adenovirus one. And the one which will be available in Bangladesh, either the Sinopharm or the Bharat Biotech, which is a inactivated vaccine. Just a couple of things quickly here for understanding, messenger RNA teaches our cells to make protein to trigger an immune response. Immune response produces antibodies and the protection from the virus. Now, two important things we should remember here. Messenger RNA vaccines cannot give you COVID-19. They do not use live virus. And the other thing, they do not affect or interact with our DNA. A lot of people had questioned whether this genetic material will enter our own body DNA and cause some alteration. To the best of our knowledge, it is not, And the Pfizer Biotech is basically, we are taking these two shots, we don't have a choice of which one we want. Like my hospital, I got both the shots, I got both the shots, but I got the Pfizer Biotech, which was available. I got my last shot on Friday. And just for your information, I have two daughters and two son-in-laws who are all physicians. We all took the vaccines. Now I'm waiting for my wife, she doesn't qualify yet because of her age, but we are taking the vaccines, We trust in Allah. We trust in the knowledge that Allah has given us, and we believe in Allah, and the cure comes from Allah. So we are taking the vaccines. And the Moderna vaccines, this is also, it's separated into 2 days. Now, what happens is immunity from vaccination, you inject the messenger RNA, the body manufactures antibody and you get immune. And same thing again, you get immune from the vaccination. Now, we do not know how long the coronavirus antibody lasts in your body. Suppose you get the coronavirus infection, we recommend you waiting a little bit, but it has been shown that it may last between 4 months and 8 months, or sometimes less than that. But my feeling is the vaccine probably will end up getting annual vaccination like flu or something. Now, this is for the doctors. I think I'm pretty much done with my slides. This is for the doctors mostly. Please, please, please don't tell you are expert. We are no experts. While I have intubated more patients and taken more patients in the intensive care unit, there are a lot of doctors who are involved in publishing this randomized control trial. I do not pass my judgment to anybody. I rely on the randomized control trial. And that is the beauty of practicing medicine in the United States. You are held liable, you are held accountable if you practice wrong medicine. And please don't tell that you are an expert. And as I told you, that the first thing I told in this talk is that I'm not an expert. I just follow the randomized control trial. So this is what is called the adaptive COVID-19 treatment trial. It's called the ACT trial. You can look at those studies later. The ACT trial 1 is the remdesivir compared to placebo, and it showed that remdesivir works if you give early. So this was granted permission to use. Understand this, we stopped using remdesivir in our hospital when somebody ends up on a ventilator or is very sick, because it is late in the disease and remdesivir does not work at that time. Now, the reason why I mentioned all this, because a lot of things you'll hear from Bangladesh about the use of remdesivir with a medication called baricitinib. The baricitinib is a JAK inhibitor. It's an immune inhibitor. It is used in rheumatoid arthritis. So in Bangladesh, they're using it quite a bit. So the ACT2 trial, says that when you use the remdesivir and baricitinib together, it may be a little bit better than remdesivir, but this is an immune modulator. And it alters your immune system. Be careful and know what you're doing. While all of us want to save a patient who is breathing 40 times a minute and breathing 60 times a minute, we want to do something, but this will cause secondary infection, as the interleukin-2 inhibitors did. And a lot of people die of COVID-19 because of what we do. We give too much immune modulators, they get secondary infection and they die. So this actually is, to me, the ACT2 trial, this is baricitinib can only be used, as far as I'm concerned, in the right patient where you cannot use the dexamethasone. So there will also be a trial called the ACT3, which is yet to be published, where they will compare remdesivir and interferon versus remdesivir alone. And this is the simple ACT4, which is not published. This will be a very important trial. That do we really need baricitinib, which is very expensive, or is dexamethasone as good as baricitinib? It will have two arms, remdesivir versus baricitinib, plus baricitinib plus versus remdesivir versus dexamethasone. Now, this is a very important slide. Please, please, please. My daughter, she's an infectious disease. She called me today. She told me, Dad, please don't give up your mask. You took the vaccines, I know. Please do the hand washing. Please wear your mask and be careful when you're in the ICU. Don't let your guards down. You had two vaccines, but that's not going to protect you. So be careful. I'm done with my talk. Thank you so much. I'm going to hand over the mic to Sohel.
Thank you, Dr. Firoz. We got a lot of good information. I'm pretty sure you will have a lot of questions that coming in your way. Let us not waste time, and let's get back to our next speaker, Dr. Akhtar Hassan. He's a general pediatrics and pediatric hematology. Dr. Hassan is an ex-cadet of JCC. He graduated from Sylhet Medical College, completed his residency training in general pediatrics from Interfaith Medical College in New York. He completed his fellowship training in pediatric from Schneider Children's Hospital, which is AKA Cohen's Children's Hospital, and Northwell Health System, New York. Currently, he is working as an attending physician, Department of Pediatrics at Southside Hospital, Northwell Health System. He is also a full-time private practitioner in Queens, New York. He's married to Roshan Hassan, a poet, writer, and a singer. He has two daughters, one son, and two stepsons. They are living in New York City for the last 40 years, and pretty much half of the New York probably knows him. He's very popular and very helpful. So let us welcome Dr. Akhtar Hassan. Dr. Hassan will be talking about long COVID. Dr. Hassan, please go ahead.
Assalamu alaikum, dear audience, my dear ex-cadets, and my collegial professional colleagues. When COVID-19 pandemic hit the mankind, we had no preparedness. We didn't anticipate. So we all were scrambling to quell and combat this pandemic. We in the medical community, as well as every one of us, were reacting to the circumstances as they were coming along. Now, long COVID-19 is real and common, also known as long haulers. Now, most people who have coronavirus disease recover quickly from the disease in about few weeks. But there are some who do not recover, who had even the mild versions of the COVID-19 linger with their symptoms of COVID-19, or they have recovered, still the symptoms reappear. Older people and people with coexisting medical conditions, serious conditions, are the most group of people who are suffering from these lingering symptoms of COVID-19. Not only the older people, but there are also very young, healthy people, those who are showing these symptoms, lingering symptoms of COVID-19. As you know, that the long COVID-19, now the question comes, why some are suffering from the lingering symptoms, why others are not? The research has shown at this point, not very definite, but this thing that the genomic material of different persons vary. And that could be a reason, like the haplotype. The haplotype, different haplotypes may be responsible for some with lingering symptoms and some are not. Now, the symptoms, as you know, with the long hauler disease or the long COVID-19 is basically debilitating fatigue, shortness of breath, cough, chest tightness, chest pain, and headache, dizziness, and vertigo, and fast pounding heart, and impairment of cognitive functions, which is also known as brain fogging, that are manifested as inability to concentrate, loss of memory, and lack of concentration. Then there are sleep problems and seizures, strokes, we also find in this long COVID-19. Then there is loss of smell and taste, and also there is severe itching all over the body, which is called the active mast cell activation. Now, this long COVID-19 is increasing. The patients are increasing in numbers. So in Europe and in America, separate clinics and separate hospital for long COVID is being established because it needs multidisciplinary management and rehabilitation. Now, as my friend Firoz has described, that most of the organs that are affected by this long COVID are the lungs, the brain, the heart, the kidneys, the vascular system. As you must have noticed in Firoz's presentation, that there is, due to COVID-19, there is hyperimmune response in the lungs. And we have this partition of the alveoli and the blood vessels, which we know as respiratory membrane, that gets inflamed. There is leakage of fluid. And over time, there is fibrosis and scarring of this alveoli or the lungs. So this scarring and fibrosis of the lungs can be well diagnosed with CT scan of the lungs and also doing the pulmonary function test. As you know, the diffusion capacity for carbon monoxide in lungs are well estimated by DLCO, which is about normal, is greater than 75% of the predicted value. But in COVID-19 patients who have pneumonia, lung scarring, fibrosis, this DLCO level goes down, markedly reduced. It is reduced to 30 to 40%, So that's about the lungs. To say a little bit about the heart, like when a post-COVID patient presents to the doctor with dyspnea, short of breath, or leg swelling, we must look into the heart. And the best diagnostic tool is the echo. With the echo in post-COVID patients, we find that there is biventricular abnormalities. There is low ejection fraction, And there is also weakness of the muscles, which you call cardiomyopathy. I'm sure Rizal will go in details about this. And in conclusion, I must say that the public health measures like washing hands, wearing masks, and staying social distancing, and even the vaccines, all these are not going to take to prevent the dent that has been made by the COVID-19, unless we buy into the beliefs and the informations that are scientifically based, double-blind trials that are coming out, the informations, and we buy into it. There are also at the same time misinformations about everything, the vaccines and everything. We cannot buy into this. So if we all follow the scientific data, and then only we can get over this disease and achieve the herd immunity that will save us from this disease. Thank you very much. I appreciate everybody's attention. Thank you.
Thank you, Dr. Bhai, for talking about long COVID. And I believe your wife, our hubby, is also going through that. I don't know if you mentioned that, but I think you told me the long COVID is an issue.
Since you mentioned, I mean, in mid-November, me and my wife, first I became positive, and then eventually my wife also tested and she became positive. Now I ended up with minimal symptoms. In 2 weeks, I was fine and back to work. But my wife's test and a smell are yet to return completely because she also at the same time has some pulmonary problems like asthma. So maybe that is the reason why she's taking longer than me. So I expect your dua that she becomes well soon. Thank you.
All right, thank you, Dr. Bhai. Our next guest would be Dr. Mizan Siddiqui. Let me give you a quick introduction on him. Dr. Siddiqui is a public health physician and a global health specialist. We are very glad to have him among us today. We're going to learn a lot of stuff from him. He's with extensive experience in immunization, global polio eradication program, disease outbreak, etc. He has also worked South Asia, Bangladesh, India, Nepal, Uzbekistan, Afghanistan, Senegal, Uganda, Nigeria, and many other countries, South Asia and Africa. In these countries, Dr. Siddiqui provided leadership and technical support to large-scale program funded by USAID, World Bank, DFID bills, Melinda Gates Foundation, and international NGOs. His expertise includes program management, monitoring and evaluation, performance assessment, operation research, etc. He also supported USAID Global Child Survival Flagship Program as a technical advisor for immunization. Dr. Siddiqui developed several applications for real-time monitoring of vaccination campaign and conducted large-scale GIS survey to assist microplan and track vaccination teams in northern Nigeria. Dr. Siddiqui has both quantitative and qualitative skill and conducted many studies and published over 30 articles, papers, and reports. He recently published a book on COVID-19 titled ABC of COVID-19, available in Barnes & Noble, bn.com. In addition to medical degree, Dr. Siddiqui has master's in public health from the University of Liverpool and master's in nutrition from King's College London. He also received management training from Harvard Business School and biostatistics from George Washington University. Dr. Siddiqui received an award from American Public Health Association for his contribution in international health. Dr. Siddiqui is a fellow of Royal College of Physicians and Surgeons, Glasgow, and Royal Society of Public Health, London. With that, Dr. Siddiqui, we welcome you to our forum, and we are very delighted to have you among us. Please go ahead and start your session now. Tawhid, can you kindly pull up his slides too? Thank you.
Thank you, Stalin, for inviting me in this webinar. And thank you all who are participating. My previous speaker have already outlined a lot of good information about vaccine. So I will go very briefly on the vaccine and then move into the global perspectives of the COVID vaccine development. So in January, the sequence of the virus was made public by China. And in a matter of 2 months, scientists all over the world was able to come up with the solution and identified which part of the vaccine from the virus can be used to produce vaccine. And in the USA, Moderna came up with mRNA technology along with Pfizer. And then in the UK, Russia, China, India, all came up with their traditional approach of producing vaccines against SARS-CoV-2. As my previous said, the randomized clinical trial is the best evidence for proving or disproving effectiveness of any vaccine. So the large-scale RCT were conducted in many countries, and then efficacy was found to be pretty good, between 60 to 95%. China and Russia and India bypassed some of these RCT criteria of largest clinical trial, still were able to produce vaccine and started implementing them to their own population. Next slide, please. This has been mentioned that mRNA is a novel technology and has been used by German biotech and Moderna in the US. Russia and UK use traditional technology using killed or inactivated virus. China and India used inactivated coronavirus itself. And few companies came up to produce synthetic spike protein in lab and injected bacteria to produce them and then put them in nanoparticle. These are called protein vaccines. Next slide. As you all know, there are at least 3 phases of the clinical trial, and then it goes into approval, limited utilization, emergency authorization. So how these vaccines were developed so quickly in about 9 months' time from January to December? Because they combined various phases, and also they use concurrent technology to produce production. So the production line was ready concurrently. At the same time, phases were combined. Researchers are currently testing 64 vaccines. 20 have reached the final stage of testing, 85 in preclinical vaccine stage. On December 10, a vaccine from Australia that was abandoned. So there was only 1 vaccine so far has been abandoned that showed that it's giving positive results in HIV. Russia, China, and India took the unusual step of allowing vaccine distribution before conducting large-scale clinical trials and finding its real efficacy. Next slide. As you can see, there are 12 vaccines. 12 companies are now involved in producing vaccines using these 3 technology: the messenger RNA technology, the viral platform technology, and the inactivated coronavirus technology, and the protein technology. Next slide. Let me go about a little bit about Russian vaccine. They, from the picture, you can see that they are the first coming up with the Sputnik 5 vaccine. And they named it in 1957 when they put Sputnik into the space. They used cleverly 2 adenovirus actually, 1 for the first dose and 1 for the second dose. And then it's been pretty novel approach. And they found out that the efficacy went up by using this combination of 2 adenovirus. And they claim that their vaccine is about 91% effective. 1.2 billion doses have been requested from more than 50 countries by now. India, Brazil, China, South Korea will produce also this vaccine in their own countries with assistance from the Russian companies. Next slide. And then Sinopharm China, also one of the leading vaccine producer. They also come up with using inactivated vaccine. In the picture, you can see that the first one is the active coronavirus, and the second one is the inactive coronavirus. They use some chemical to inactivate it and then use it to produce the vaccine. Both these vaccines, the Sinopharm and the other company, both of them require 2 doses, and they can be stored in normal refrigeration as well. Next vaccine. Next slide, please. Sinovac China, the vaccine name is CoronaVac. They also produced using the similar technology of inactivating the vaccine with a chemical. And they also use 2 doses, interval of 14 to 28 days, and they can be stored in normal refrigeration. The other 2 companies, CanSino Biologics and Anhui Zaifi, are also trying to produce 2 other vaccines. One of them will be protein vaccines, another one would be adenovirus vector vaccine. Next slide, please. COVAX in India, they recently approved this vaccine for their own population, but they have not come up with the whole results of the RCT. The large scale trial is still ongoing, but they bypassed that and then wanted to continue the Covaxin like Russia. So they also use the inactivated coronavirus to inoculate people for the COVID-19. Next slide. Pfizer and BioNTech, you can see that the BioNTech, the Turkish scientist, Dr. Ugur Sahin, is the one who came up immediately in January with the idea of mRNA vaccine. mRNA vaccine basically taking the genetic code of the messenger RNA, and then they put an envelope into it and then inject to the arm that goes into the cell, but it doesn't go into the nucleus. It only remains in the cytoplasm and then produce the spike protein that comes out and then produce immune response and then gives the antibody to the human being that protects from subsequent infection. Actually, subsequent infection can happen. However, the outcome of these vaccines are basically limiting severity of the disease and hospitalization and death. It may cause some mild illness. Next slide, please. Similarly, Moderna vaccine also came up with a lipid nanoparticle surrounding the messenger RNA. They also do the same mechanism as the BioNTech vaccine and then produce the spike protein, present it to the immune system to produce antibodies. Next slide, please. These Moderna vaccine, because of their fragility, they need to be refrigerated also, but they are much more stable than Pfizer vaccine. Pfizer vaccine requires about -70 degrees centigrade and causes problem with the cold chain. Particularly, it would be difficult in developing countries to freeze these vaccines, Pfizer vaccine, compared to a Moderna vaccine. An early study found that Moderna vaccine provides protection for at least for about 3 months. And each vial contains 10 doses of 0.5 milliliter. And vial need to be warm to room temperature for injection. It does not require no dilution compared to the Pfizer vaccine. Next slide, please. Oxford AstraZeneca vaccine used the adenovirus platform, as my previous speaker already spoke. They induce the DNA into the adenovirus, and that adenovirus, which actually kill virus, goes into the cell, into the nucleus. This one goes into the nucleus and then produce the messenger RNA that came out and then produce the spike protein to produce immune response in the body. Next slide, please. So this is the whole sequence of the Oxford vaccine trial that started as a randomized control trial. And they did a large study, and they were basically now the front runner in terms of vaccine rollout in most of the developing countries. Next slide, please. Oxford vaccine requires 2 doses, 4 weeks apart. During the clinical trial, researchers unwittingly gave some volunteers only half dose, but surprisingly, they found out first dose was more effective than the second dose. But overall, it's about 62% efficacy with 2 full doses. Next slide, please. The Johnson & Johnson is also testing a vaccine. And this, the advantage of this one is that they will have to give only 1 dose of the vaccine, but they're also now trying 2-dose vaccine. They're also using the viral platform. This is yet to be published, and efficacy is still not known, but it's a very promising vaccine. And it's also at room temperature, and it can be rolled out to developing countries as well. Next slide. Novavax vaccine, as our previous speaker said, that is a protein-based vaccine. The protein is produced by injecting the coronavirus vaccine into a virus, different virus, and that virus then produces the spike protein, and then they produce this nanoparticle of the spike protein and then injected human to produce antibodies and immune response. This is also in process and is pretty promising. Next one. So this is basically a summary. I already spoke about it. Please go to the next slide. How to secure vaccines for the whole world? We have about 8 billion people, and to produce herd immunity, we need about 80 to 85% population to be vaccinated against COVID-19. So in the US, the speed has been pretty much fueled by the US. The Operation Warp Speed program subsidized development and manufacturing of half a dozen novel corona vaccine. And the US unilaterally took the lead, and they basically are now the champion after the UK vaccine to be able to come up with a novel messenger RNA vaccine and be able to produce in bulk amount, and is going to be free for the entire population. About 330 million people are being targeted, and hopefully by the end of this year, they all will be given this vaccine. Countries have struck deals to secure access vaccine access. About 8.35 billion doses have already set aside. The problem is that most of the vaccine deal has been done by the rich countries, US, UK, and European countries. Canada needs 38 million, but they already procured 112 million people. So that created a big issue for the rest of the world, how they will get the vaccine. So Gavi Global Alliance of Vaccine came up with the idea of COVAX Alliance with World Health Organization to ensure equitable vaccine distribution. The agreement extends to most of the countries in the world, including many in Africa and in Asia, including Bangladesh. The Mexican billionaire Carlos Slim, he came up to fund about 2.2 billion doses to secure vaccines in Latin America region mostly. Russia and China are not striking the same sort of deals. Instead, they will rely on domestically produced vaccines, such as Sputnik V shots made by Moscow-based Gamaleya Center, or those made by China's state-owned pharmaceutical giant, Sinopharm and Sinovac. AstraZeneca 2-dose shot is the early leader with pre-purchase agreement that would cover 1.48 billion people, more than twice as many as any other candidate. So that also related to the cost of the vaccine. Next slide, please. I think this has been discussed that who is producing how much vaccine. AstraZeneca is the leader. They are going to produce about 3 billion doses of vaccines. Moderna and Pfizer are mostly supporting US and the European countries with their production. However, the Oxford vaccine and the Indian vaccine will be supporting the rest of the world. Until today, about 24 million doses of vaccines have been administered in 41 countries. Next slide, please. I already mentioned about the global effort to stop COVID, that so many countries came forward and so many companies came forward. The private and public partnership were key for this big achievement. In the US, so far already 7.73 million doses have been given. And Israel has given much faster than any other country to their population the vaccine. Now, about more than 24 million doses have been administered in 41 countries as of January 7, mostly limited to USA, Canada, European Union, China, Russia, and Middle Eastern, all rich countries, UAE, Bahrain, Saudi Arabia, and Morocco. The countries in Asia and Africa who are low income and middle income countries are still far behind to access the vaccine. Next slide. This is these are the number of vaccines and which country got what. China, US, Israel, and so many other countries that are rich countries have access to this vaccine and are already provided so many millions of doses to their population. Next slide. The global collaboration I already mentioned to you. The initial aim is to have 2 billion doses available by the end of 2021, which should be enough to protect high risk and vulnerable population. The idea is that at least they are supposed to give 20% of their population made available to these countries through this WHO COVAX mechanism. So far, 78 higher income countries and economies have confirmed their interest in participating in COVAX facility. Already $2.4 billion has been secured by COVAX from different countries, foundations, corporations, or organizations like Bill and Melinda Gates Foundation. 92 low and middle income economies are eligible to have their participation, and Bangladesh is one of them. Next slide, please. So low income, lower middle income, and additional other countries are going to be getting these vaccines through this international COVAX facility. And hopefully Bangladesh would be able to have access to vaccines to its population. Next slide. What is the cost of these vaccines? So far, the data that we have now is about $20 for the Pfizer vaccine for 1 dose. So it will take about $40 for 2 doses. Moderna about $15 to $25. So it will also cost you about $30 to $50. Oxford one is the most cost-effective, looks like. It's about $4 per dose. And then the Indian Covaxin, if it comes out to be a winner in terms of efficacy, about $2 to $5. And I understand that Bangladesh has struck some deal with Indian vaccine and the Oxford vaccine to access these 2 vaccines for its own population. Next slide. So what are the concerns? My previous speakers have already raised some of the concerns. So far, all vaccines used found to be very safe, especially very safe, and efficacy range from 60 to 95%. In order to develop herd immunity, around 8 to 85% population have to be vaccinated. It's almost like polio vaccine based on their efficacy rate. And you know that the efficacy rate is calculated using the R-naught. Vaccines will not stop future infection. You can be reinfected and transmit virus to others, but vaccine will protect you against severe COVID-19, and it may cause mild symptoms or no symptoms. Until herd immunity is developed and transmission is interrupted, we must maintain, as my other speaker ended with his slide, face mask, social distance, and wash your hands, and avoid crowded places. And as we know that 50% cases are asymptomatic, and a younger population with no symptom keeps transmitting as efficiently as anyone else. The history of allergy is the main contraindication or is the main concern for COVID-19 vaccine. So your own doctor needs to be consulted before giving the vaccine if you have a history of allergy. But this is true for any vaccine. It happens about 1 in 1 million to 2 million people. And that's why Pfizer and Moderna advised for 15 to 30 minutes observation, keeping the epinephrine handy and availability of transport to the hospital if necessary. The messenger RNA vaccine, as my other speakers said, does not go to inside the nucleus cell and does not have any chips and does not do any harm to your DNA or nucleus. We need to protect people and vaccinate to stop this pandemic. Should not listen to rumor and unscientific claim and promote vaccination as much as possible. Thank you. Thank you, Stalin.
Thank you, Dr. Siddiqui. Just a quick roll call check. Is Daud here? I know a few of our doctors, they had some other things to do. Is Daud or Rizal here?
Rizal, I'm here. Daud I think he had to leave. I saw a text from him that he was going to a hospital to see
He
a
was
patient.
going to the hospital. Okay, Rizal bhai, you will be next. So
okay.
Give me 1 second. Let me introduce you.
Why didn't you keep my introduction very short so
yes.
I can just talk, you know?
Sure. So our next speaker is Dr. Rizal Islam. He is specialist in board certified in cardiology. He has his own business with one partner, have an office which covers angiogram, suite, ecolab, nuclear cardiology lab, etc. His skills include cardiovascular, coronary, angiogram, coronary, stents, etc. He graduated from Dhaka Medical College and then went to UK in 1989, and he was a registrar in UK. He did his residency in medicine in Western Pennsylvania Hospital, USA, and completed his residency in internal medicine in 1995. He has his fellowship in cardiology at Western Pennsylvania Hospital from 1995 to 1998. Currently, he is in Monroe, Louisiana. With that, I'm requesting Dr. Rizal Islam to go ahead and talk about a few things on COVID and how it affecting heart and everything else. Please go ahead, sir.
Thank you so much, Sohel. Can you hear me?
Yes, we can hear you.
Okay, great. So, Ami, actually, since the audience is mostly like non-physicians, I'd like to keep my talk in simple layman's term. The other speakers gave us a lot of information about COVID and vaccine and all that, so I'm not going to get into that, of course. My specialty is cardiology. So question that was raised to me by Stalin is, how does COVID affect our heart? So it's a just a new disease that we have not yet grasped what it does in total and what will be the long-term effect of this disease on human organs, different organs. Amra jeta cardiology jeta dekhi COVID, it is affecting the heart muscle in great numbers. But the good thing is that it's not causing serious issues from it in most of the patients who are recovering. Jara mara jaচ্ছে, they are dying because of involvement of the lungs and heart. Kidney আছে, kidney failure হচ্ছে, কিন্তু the people who are dying because of lung failure, respiratory failure mainly, and then quite a good number cardiac involvement. So how does it involve the heart? What we have seen that this virus can cause inflammation of the heart muscle. It's called myocarditis. Myo means muscle, cardiac means heart, itis means inflammation. So we put all this together and we call it myocarditis. So it causes inflammation of the heart muscle. Our heart muscle is one of the strongest muscle in our body, and it is working day and night without any rest. Kono pause nai. If you can think like that. So it needs a lot of nutrition and oxygen is supplied through the blood vessels. And these blood vessels are very tiny. They are about 3 millimeters or less in diameter. And the heart is pumping blood, but the first blood vessels from the heart goes to the heart muscle. There are two things that can happen in COVID. একটা হচ্ছে heart attack. One is heart attack. And heart attack can be caused by all this stress that COVID produces in our body, causes release of lot of hormones like adrenaline, non-adrenaline, and that can trigger a heart attack by rupturing one of the plaques. যেগুলো cholesterol buildup underneath the blood vessels of the muscles of the heart can rupture, and that causes clot formation on top of the cholesterol plaque, and that shuts down the blood flow to that particular part of the heart, and that is called heart attack. Heart attack pathology অথবা how heart attack happens this is the principle, this is the main cause of how a heart attack happens. আমাদের blood vessels এর মধ্যে plaque থাকে, cholesterol build up থাকে, one fine morning or evening it decides to rupture, and then as soon as it ruptures, our body thinks it is bleeding. Blood vessels gula tokhon okhane platelets giye they attach to that part, and the clot is formed, so that the hole, the lumen of the artery is closed completely by the clot, and tokhon that part does not get any oxygen from the blood, and that is heart attack. So the muscle, that part, ওই particular area muscle gula, they die from lack of blood flow and oxygen. So that is heart attack. So that's one thing that happens from COVID. আর একটা জিনিস হচ্ছে যে COVID is initiating clotting process. So that is also
We can't hear you, Rizal.
Sorry, Rizal, hey, unmute, please. Unmute, please. Rizal, we cannot hear you. Unmute, please.
Can you hear me?
Yes, go ahead. Sorry. Continue.
I don't know what happened. I didn't even touch my screen.
It's my fault. I'm sorry.
আচ্ছা ঠিক আছে। তো সেকেন্ড ফেনোমেনন অফ এ হার্ট অ্যাটাক অথবা মাসল ড্যামেজ, হার্ট মাসলের ড্যামেজ হচ্ছে মাইক্রো ক্লট, মানে খুব ছোট ছোট ক্লট গিয়ে হার্টের ছোট ছোট আর্টারি গুলাতে গিয়ে চলে যাচ্ছে। সো দ্যাট ক্যান অলসো কজ ড্যামেজ টু দি এন্টায়ার হার্ট মাসল। হ্যাঁ, সো দিস ইজ টু থার্ড মেকানিজম যেটা বললাম যে মায়োকার্ডাইটিস। So this virus itself and the reaction of our body is called cytokine storm. So a virus's insult is so huge that our own body produces a lot of chemicals called cytokines. A cytokines gula tokhon, this causes all this problem of inflammation and blood clot and all that, and myocarditis. So once you develop myocarditis, the body automatically takes care of it over time. But then who is going to recover, who is not going to recover, it's very hard to say at this point in time. Jader myocarditis hocche, we'll have to see how they recover over time. So only time will tell us what's going to happen to these patients. There was a study যেখানে they did MRI. MRI is a scan. It's a picture taking, medical picture taking procedure যেখানে আমরা অর্গান গুলাকে খুব ডিটেইলে দেখতে পারি। So they took 100 sick patients of COVID and they did MRI scan of the heart, and they found out 78 out of 100 patients had inflammation of the heart muscle. So it's happening very, very commonly to COVID patient, but the thing is that we do not know yet the long-term outcome এটার কি হবে. So with that, I will leave my talk here.
Thank you, Rizal Bhai, for taking your time. I know a lot of physicians and you're a very busy person. Appreciate the time. These are very good information. Thank you for your patience.
Thank you.
Our next speaker for today, who got affected very early. He's from New York. He got affected, he survived, and he's helping continuously a lot of people in New York and Bangladesh and many other places. Let us welcome Dr. Masood Rahman. He did his residency in anesthesia and fellowship in pediatric and pain management, working as an attending anesthesiologist in Elmhurst Hospital, New York, and Queens Hospital, and pain specialist at South Shore Neurology, Long Island. He is also an ex-president of JCC and current North American president of CCNA. Dr. Masood Rahman, I'm requesting you to start your session now. He will be talking about how and what we can do when we are affected by COVID and when we are quarantined at home. Dr. Masood Rahman, please go ahead. Continue.
Assalamu alaikum, everybody. Can you hear me? I hope you can hear me.
Yes, we can hear you. Please go ahead.
Very good.
Tawheed, this is not the slide.
Yeah, I have no slide. Please bring the. Anyway, when I was a cadet in United Cadet College, I represented my college as an English extempore speaker. I Well, it was the best over there. And I thought that how can I speak so much that it will take 5 minutes, 4 minutes to 5 minutes time. I didn't have that much of talking, subject, but now I have been given that you have got 3 to 5 minutes. I'm thinking, how can I finish within that time? However, I will try my best. I know, Sohail, you are doing a great job of keeping the people in time. Anyway, at the beginning of this year, last year, January, February, when we just came to know about COVID, reading the different journals and other things, I was one of the guys of New York that we were going to the community television and talking about the COVID and what it is and what we can do, etc. In the early stage, remember, it's the evolving disease. We don't know. None of us know the full treatment as yet. None of us know how the vaccine, how long it will go, it will give the immunity. We do not know these things. These are evolving, as Rizal said very nicely, that we do not know all things. And as Firoz Bhai said, I 100% agree, none of us, here at least, are experts. We are just we're just sharing our own experiences with that. However, I was affected by COVID while talking and looking at patients. You know that I have to intubate COVID patients, and I did last on 25th. Every day almost, I have to intubate COVID patients. So my nose is very close to their mouth. Of course, with mask, but I have more chances. So I got it, I brought it home. My entire house was affected, my 3 kids and my wife. And it was different at different places, different persons. So COVID can present in many forms, very mild or nothing, asymptomatic, or can almost be killing. In-house, outside the house, in the hospital, 3 to 4, 5% people, those are really severe. Well, my one was also close to severe, but I didn't want to go to the hospital because I knew my hospital was losing a person every 1 to 2 minutes. If I went there, I would be mentally depressed. So I didn't go there. My friends, Dr. Habib Rahman, who is a pulmonologist and critical care specialist, was also treating me at that time, like Firoz Bhai, the same degrees. He was treating me at that time. So I'm just going to share with you how you can and what you should do at home. Number 1, please, it's a message for, as once again, Rizal is correct. Let us talk to non-physicians in most layman terms. Physicians know it already, and we have got best information from our experts just a few minutes back, like Firoz Bhai and Dr. Siddiq. Thanks to them. Now, the simple thing is that please keep on taking. Either you had COVID or you yet to have or didn't have COVID. Everybody believes that I will not have it, but almost everybody is getting it. So please do one thing. Take vitamin D, vitamin C, and zinc. And watch your weight. Most of the patients who died from COVID are obese, elderly, obese. Most of the patients who died from COVID did have deficiency in vitamin D. So please take vitamin D, vitamin C, zinc. And if you have temperature above 100.23, below that you don't need to treat. You can always take the Tylenol or acetaminophen, or in Bangladesh, Napa. Those are the things you can take. Now, keep yourself hydrated. Always keep yourself hydrated. Take a lot of water, a lot of coconut water, or whatever you like. But keep yourself hydrated. At some point, I have treated about 160 patients in Bangladesh and in America after I recovered from COVID, because it became a thought in my mind. I was almost dead. I thought I will die. I even told my wife that I'll not cross this day. So I thought I'll die, but I survived. So what I did is, my friend did not. What I did is, it was a thought in my mind that I'll be helping anybody from anywhere. So I started to talk to many people, those who didn't have COVID yet, but those who had COVID, they were calling me by seeing a video. I made a video which has hit more than 1 million hits, more than 1 million now. It has gone to many people when they call me. Now remember, those informations are not the latest informations. Informations are changing every day. And I told that in the video very well, that those are changing. So at home, when you are there, You may have malaise, body ache. The body ache is severe. Believe me, it is severe for me. For somebody, it's nothing. For me, it was like all my life, I had lots of flus and others. I had body aches. All those combined together was less than the body ache I had during COVID. So much of body, so much of weakness, unbelievable. So that was the pattern I was facing. What more we have done for these 160 people, some of them are cadets. I have also talked to people who didn't have, like I have talked to all 3 M's of first batch. Mudassir Bhai. Then I have talked to Munir Bhai and Mohidin Babar. The 3 M's of first batch, I have talked to all of them. I've given them what I was doing and what they need. So like this, I have given to everybody what I could. Even if it is not, you know, what do you call it? Sometimes you will have a little difference of the clinical trial strictly, but that is to be followed without a question. But strictly, there may be a little difference in your practice. And every doctor will probably agree to that. A little different. Now, we have given dexamethasone to many people who we thought, we means me and Dr. Habib, we together tried to treat most of the patients and more than 160. Among them, Mr. Farukdev Sinha, the house tutor of Hunan House, his daughter was also there. I treated her too, Shaila or Mita, who is in World Bank now, her husband and me, and her, I treated them, and they are all fine. Out of 160, all are fine. Doesn't mean that I have done the best thing. It means that I was lucky or they had very little to have. It could be like that. But everybody is out of the danger. So remember these things. If you want at home, you can use this. You know, there are 2 problems, 2 pathologies we know, 2 main problems. One is the cytokine surge, as Dr. Rizal just said. The cytokine surge, other doctors also said, the cytokine surge or the storm of cytokines that creates problem in the lungs, fibrosis and other things. To stop that, you take dexamethasone. And there is a clear-cut dose depending on patient to patient. While you talk to the patient, you decide how much you want to start with. The other thing is the blood thinner. At home, I have given enoxaparin injection to many of the patients, and they're all fine. There was no problem. Once again, I don't claim myself as an expert, but this is what we have done. Me and Dr. Habib, who is the director of ICU of my hospital, we have done that, and most of the patients have become fine. So at home, really you should, when you think you should go to hospital, when? I mean, there is a line that you have to go to hospital, no more home treatment. When you see you cannot breathe anymore, trouble breathing. When you see that persistent pain of chest, you talk to Rizal at that time. You don't remain at hospital, at home. You go to the hospital. That's the second one. And when you, new confusion means something is happening in the brain. Maybe some blood clot in the brain. And the confusion has happened. If you find a patient like this at home, please send him or go to the hospital. Inability to wake, you feel sleepy, and bluish lips means you're really deoxygenated. Your oxygen is really, really low. You have to understand that. With that, some adjuncts are there. Remember, some adjuncts are there that you can practice at home. And this has been good for all the patients that I have, and I don't find any kind of opinion against it. That number one is you take warm water. You take tea with ginger and other sweet mix soothing, helping. You take the steam therapy. I have told about steam therapy before also. The steam therapy, you put hot water, steam comes out, have a towel over it, breathe it in, exhale it out. That gives you a lot of soothing, a lot of better feelings. That's another thing. And the other thing is your prone position. Remember, this is scientific. This is not that what I do. This is totally scientific. You be in prone position when your pulse oximeter shows that you're like 94 or low, 93, 92. Be in prone position. If being in prone position, what happens? Like this, upur hoye shoa jetake bole. Why is that helpful? That's very much scientific. Reason behind that is the lung in the front of it is thin. At the back is big. So the most of the surface area of lung is at the back. When you put the back at the top, then it's more perfused and more ventilated. It's already more perfused. Now it is more ventilated. The ventilation perfusion ratio that decides our oxygenation is much better. Remember, many people I have seen during my practice that when it was 90, 91, 89, they all became 93, 94 after some time when practicing 2 to 3 hours of being prone position. So these are the main things. At home, anybody can call. We will always be trying to help. It's just trying to help. Anybody of you that you know somebody is having COVID or anything, me, Dr. Habib, we have a team. We will get into it. We'll try to do our best what we can do about home. At some point, one has to go to hospital, and that's a different issue. You know what is there. The treatment is very good. Nowadays, monoclonal antibodies and other things. And finally, the other thing that I want to tell that most of the doctors have said, but this is also very, very important. Mask. Firozbhai's daughter, I agree with her. Mask. Now, what are the masks? There are mainly, don't buy the fancy Gucci mask or those, we don't know about it. But these are good masks. This one. One is surgical, it's simple mask. This is a K95. K95. It's not the most sealed one. This is 95, and Jahid, I've seen Jahid is wearing another 95. This is N95. These I'm using for last more than 2 decades because I'm an anesthesiologist and I have to use those things for different patients. That's one. And lastly, I'll take 1 more minute from Stalin to say a few things. Take home, just take home what I understood. Take home message of the vaccines. Vaccines have been explained excellent way, and we have learned a lot from Firozbhai and Dr. Siddiq. But the take home message is this. Please take the vaccine. It doesn't cause severe allergy. Very rarely. It causes 1.3 in 1 million doses. So that's good. It's a safe thing. It causes local pain, little malaise. I took the vaccine, Pfizer, as Firozbhai took. So it causes local pain here in your injection site. Next day, second day. And it causes a little bit of malaise. That's all. 1 tablet of naproxen I took, and that's all gone. So it's not a problem. It doesn't cause that much problem. If you take it, don't think that you're immune immediately. Please wear the mask still, because you have to have the second dose to have the 95% efficacy. It's clearly told. So after second dose, it takes 7 to 10 days in Pfizer. It takes 15 days in Moderna, 15, 20 days in Moderna to develop the immunity. And despite you have your immunity, after that also wear your mask, because others are not immune, and you can have some in your nose, you can have some virus there, and you can exhale it to others. It's not hampering you, it will hamper others. So please, these are the take-home. To me, it is the take-home message for my friends who are over there, my senior brothers, my junior brothers who are over here. Wear the mask, wash your hand 20 seconds. You see, Sanjay Gupta has said that sing the happy birthday song twice. That will take 20 seconds. You can say, A'udhu billahi minash shaitanir rajeem, and say Surah Fatiha and Surah Ikhlas, 20 seconds, done. So you do wash your hand, keep the distances. Thank you very much. Remain safe. Any question later on, as Stalin will be giving the permission, we'll be talking at the time. Now, Stalin, I have to tell one thing, ending, that you are Stalin, but you look more like Rasputin, not Stalin. Thank you.
Thank you, Masood Bhai, for all the good information, and a lot of information we got for the non-doctors. I think this is very valuable, what to do and what not to do, and vaccine, whether to take it, not take it. So that's a very, very good information. And we got so far a lot of good information from a lot of doctors. Next, quickly, we are moved to last portion of the speaker for today is joining from Beijing, China, Masudur Rahman, computer engineer studied computer engineering, but he's working for Bangladeshi government. I do not have his whole bio, but he's the Deputy Chief of Mission and Minister, Bangladesh Embassy in Beijing. He will be talking about China, the COVID virus, and how China controlled and what they're doing today. Mr. Masood, please go ahead, continue. We also need the slide for him too. Tawheed, thank you.
Bismillahirrahmanirrahim. Yes, do you hear me?
We can hear you, please go ahead.
Okay. Since my arrival in China in October 2019, I never thought that we are going to embrace this tragic events caused by COVID-19 pandemic. Initially, it was not pandemic, as World Health Organization didn't mention that. Gradually, it went down to that designation in April. I just hurriedly made some points, basically paying rich tribute to my senior brothers who have spoken so eloquently on the medical aspects as well as vaccine issues. I will basically touch upon the China's experience, how they were so successful. Next slide. The Chinese government, after it became apparent that there is the coronavirus infection on 20 January, the president of China very resolutely said, our country's first choice is people's safety and security. And by that, he meant it very seriously, and there is the central government led by the president himself who took control of the COVID fight. And also he designated all his state councillors to form a body under him. And it is a very powerful body who actually oversaw the subdivision of the responsibility to the provincial governments, who were very much thorough, and even for the mishandling of the Wuhan city, the mayor of the Wuhan city had to go. And there were some of those evidences. First, Wuhan was cordoned off on 23rd January, night of 23rd January. Our students were actually causing us a lot of pressure for them to get back to home. And we had to hurriedly make a shifting of the students to Bangladesh by our national carrier. And it was done all through digital process. That is no boot on the ground in Wuhan. We did it through the WeChat and other social media platforms, and so on and so forth. Well, coming back from that COVID pandemic, the Chinese economy in the first quarter suffered. It was less than 2%. In the second quarter, it grew by 3.5%. And in the third quarter, the IMF is projecting that Chinese economy is going to grow by 7.9% just day before yesterday. And this is because of the dual circular economy. That is a way of how they circulate the domestic economy, increasing consumption pattern to make it more moving, as well as by overseas trade, by more imports and by more exports. So this dual circular economy is coupled with the digital economy as well as marketplace through this wonderful use of 5G, artificial intelligence, cloud computing, big data. In all these areas, China is actually having the most of the patents in the global context. And China has actually demonstrated a strong contact tracing using this big data, cloud computing, using of 5G and artificial intelligence. Actually, there is other area is civil aviation control is one of the tightest, and there is always 14-day quarantine you have to do after getting in to some remote airports they have chosen for international destinations. And even coming to Beijing, you have to have 7 days self-quarantine and some tests. So it is a very serious, stringent policies they have taken. And in customs control, they have imposed very carefully so that no virus comes back. The three principles of the control is actually the install the control of the how to control the source of the infection. They have identified it through the technology, digital technology, and they can easily clamp down on the spread. And then they cut the root of transmission, that is isolation and other things. They do it very quickly and protecting the vulnerable group. They have taken 8 approaches. That is one unified and effective commanding system that I mentioned under their president, law-based and science-driven strategies they have taken. They have taken 4 early measures and mobilizing the general public. Then the coordinated deployment of resources are very nice. You all know that they have created 2 larger scale hospitals inside 2 weeks in Wuhan. And that is a great example of how rapidly they can mobilize resources and technology and efficient people. They have applied high-tech measures, and they have pro-people and for the people policies, and they have international exchanges and cooperations across the world. We have exchanged with China the COVID fighting materials like many other countries, and that has really went long. Actually, our embassy has sent the Chinese technical health officials to Bangladesh to help Bangladesh better fight the COVID. We also are working with Chinese side for in other areas like vaccines and also creating hospitals specialized for COVID fighting. Now I talk about preliminary understanding of disease features. We all know about it. This is a little bit technical. It actually spreads through the droplets, but actually it actually can spread through the air, actually 6 feet distance, or some say it is about 2 meter or 1.5 meter. So that's how they have made all the lines, queuing lines in the airports and other places. And incubation period is 1 to 14 days. And it has in China, they have found out that it is 80% cases are mild to moderate, 15% severe, and in 5% cases, it is critical. The fatality rate in Wuhan is actually 2.54 as of now. There is no death, no new cases in Wuhan. We have in China a second wave where we have, in our south in Hebei province, we have close to 100 infections every day, but it is not growing up. It means that they do the contact tracing with the technology so fast, and then they apply the rapid testing for to millions of city dwellers within just a week, and then they isolate the infected people. They do it so quickly that it doesn't cripple the city. So that's how they are doing it. Here is a diagram. I will not go into it. Now, the surveillance case definitions are for China is like this: suspected cases, confirmed cases, asymptomatic infected persons, cluster of cases, and close contacts. So all these surveillances are being done through the big data and use of the camera. Basically, in all of China, if we need to travel, we have to use a health code. And with that health code, we give our passport, we give our name, and we scan a code. And in just 10 seconds, it shows that whether I was in any infected area or any suspected area under this classification. There are 3 full coverage. There are 2 closed cycles and 4 ensures point for the prevention and containment and treatment and medical rescue. They ensure every suspect case and they ensure them to be quarantined. They ensure every confirmed case to be hospitalized. They ensure everyone needs to be tested and should be tested who are suspected. Ensure every patient and they ensure they have to be attended. And their data always gives the right information. There is no misinformation, and there is proper way of admission and treatment facilities, and their hospitals are very much secure. So for normal treatment, those section is segregated from the special COVID section or any testing sites. They have designated 3 area: low risk area, medium risk area, and high risk area. And there is provisions and guidelines for that. And the 4 earlies, as I mentioned previously, are actually early detection, early report, early quarantine, and early treatment. The more they do it early, the better the fight is. And prevention and containment are basically based on community control, proper screening, epidemiological survey, and they can get back to find out that cluster, and they can get back to the isolation and spotting the infections and isolations. They have nucleic acid testing, but now they are also enforcing IgG test, immunoglobulin test, before coming to China. So anybody who wants to come to China has to have 2 tests. That is nucleic acid test, NAT test, and also IgG. And it is quite interesting that those who have come to China, they will have to spend 14 days quarantine in a hospital paid by himself. And the containment strategy in China is actually very interesting. They have social distancing measures, travel related measures, as I mentioned, environmental measures based on the personal protections, and case and contact managements that also involve the intricate technology given by the ICT, and they interrupt the transmission. Usually, the 4 categories of people receive different levels of centralized treatment. That is, all confirmed cases are centralized admitted, all suspected cases are centralized treated, and all patients with fever are also centralized isolated for observation. And all close contacts are centralized quarantined or observations. So actually it is a very rigorous procedure in China, and that's why they have been very successful in containing COVID-19 and getting their economy right back into track. And as I listen to my senior elder brothers who are much senior to me, whom I have met probably in my very earlyhood in Cadet College in reunions, but listening to their very good lectures full of informations, we all could understand that the severity and the lethality of this virus that has struck us. And actually China's policy of these stringent measures actually demonstrate that they also don't want this virus to affect them. And that's why they have taken this to that level. In any Chinese media, if there is new cases, the news headline says that city went on war mode. So they take it like a war has taken place, as if. So that's why they really can fight this invisible enemy of the mankind. So with this, I really thank you and thank Sohail to invite all of us for this occasion. Thank you.
Thank you, Masood, for joining from Beijing. I know it's a very late night for you, but we do appreciate your time coming in, hanging in there, and got a lot of good information. Now we are going to move into, hopefully you guys enjoyed and enjoying. Thank you to our doctors. They took their time. I know they're very busy. We all are busy, The doctors are very critical in this time. So now we are going to move into Q&A, and then we'll go to one-on-one question. But there are some questions I got either through text, email, or in chat box. So, and kindly I'll request the doctors not to just take a few seconds if you can, because we have too many questions. So with that, I'll start first, some easy question that I got through text and email. And this one will be for Dr. Akhtar, Mohammed Akhtar. And the question is, do you have to wear a mask if you get vaccinated? Mohammed Akhtar Hassan, please. Akhtar bhai, please. Can hear you. Unmute, please. Akhtar bhai, you have to unmute. Looks like we are having some. Okay, please go ahead. So the question again is, do you have to wear a mask if you get vaccinated?
The question has been answered in the previous lectures that yes, you do.
Okay, thank you very much. The next question comes from, can COVID spread from food? Dr. Masood Akhtar. Masood bhai, please, you go ahead.
Ask me?
Yes, please.
Well, no such information is there about that it can come through food. It doesn't. At least so far, the knowledge to the date, I don't know anything of that sort.
I may add to it. Actually, when you go to the grocery and you bring in groceries, you do have to clean because the virus can be on the surface of the groceries, food materials. So you need to be very careful about that. That much I can say.
Thank you. So looks like the food doesn't.
May I add, Sohel, may I add? Actually, in Beijing, during the second wave in November, there were new cases of COVID patients, COVID new infections locally transmitted, and it is not from the imported cases. And they then made a crackdown on using this system, a digital system of tracking, and they found out that it is coming from the international seafood market. It's a huge market where they have some salmon fishes, samples of salmon fishes. They tested that. Those are imported from European destinations, and they tested, and then they found traces of virus, the COVID virus. So we cannot rule out. So that's why they have imposed a very stringent customs mechanism at the port of entry to check anything frozen items.
Okay.
Frozen.
All right. Thank you for Akhtar bhai and Mr. Masood. Thank you for adding that. But kindly, when we mention the name, kindly if that person could attend so that we don't have too much noises. But Mr. Masood, I do appreciate your input in this. The next question is for Dr. Abu Said Firoz, which also came from Austin, Texas. I collected all this from Austin. If I was affected and then recovered, can I be a carrier for COVID? Firoz bhai, it's for you.
Yeah, okay, I've got the question. So if you get affected, could you be a carrier for COVID?
And recovered, can I be a carrier for COVID?
You can still be, but majority of the time the answer is no. But sometimes, we are seeing this recurrence of the COVID and reinfection and all. Now, to answer the question another way, when we get the vaccine, the vaccine only protects you. Can you hear me?
We can hear you loud and clear.
Okay, so when we take the vaccine, the purpose of the vaccine is not to prevent COVID. The purpose of the vaccine is to prevent a severe infection and dying. So if I had 2 vaccines, can I still give it to my wife? Yes, I can get the COVID, from the hospital and bring it to my wife and give it. So in general, the answer is most of the time no after the initial period. but there is always a risk because of reinfection. Thank you.
Thank you. This question also comes from Austin, Texas, from Ms. Akhtar. She asked, and this is for Dr. Mizan Siddiqui, how long does the vaccine work? We heard its lifetime is 2 years. Is it correct?
You hear me?
Yes, we can hear you. Please go ahead.
All right. Well, the answer is yet to be established. The studies are going on, and some studies showed that, as in one of my slides said, that few months. However, the B cell immunity, our immune system can remember the infection or the virus for a long time. So it is expected that at least 2 to 3 years or few years, the system will remember and will be able to respond. But the data are not yet there to say exactly how long you are protected from the vaccine.
Okay, great. Thank you. Our next question comes from Mr. Firoz from New Jersey, and it's for Firoz Bhai, I think. How are the hospitals doing any contact tracing, and are they informing the hospital staff positive results?
Yeah, most of the questions were on chats, and I tried to answer some in the chats. For the hospital, what they're doing, for the hospital staff and the patient, they are doing the contact tracing and informing. But outside for the general public, the health department is picking up, So the hospital is doing it for the hospital patients, staff, and, those, but they're not going out to the community and doing it. Thank you.
Thank you, Firoz Bhai. Next question comes from Saeed Aziz from Austin, Texas. He participated in all our program. He has 2 questions, one for influenza vaccine and the other day-to-day medications. People do not question about manufacturer, research, etc. Should that be the same case for COVID vaccine, or should we be particular or picky about the manufacturers of the vaccine, like you can choose in between Pfizer, Moderna, AstraZeneca, or anything else? This question goes to Dr. Mizan Siddiqui.
All right, do you hear me?
Yes, please go ahead.
All right, well, the issue here is basically because of the supply and demand. As long as vaccines are 94, 95% effective, it doesn't matter, which are the producers. I think the person who questioned, it's a very important question. The CDC or WHO or anyone does not differentiate. However, whoever gets the vaccine, they get 4 to 5 pages of manufacturer information about the vaccine, its side effects, how it is produced, and so on and so on. So you have every right, and it's unethical not to provide manufacturer information to someone before or after giving the vaccine. But I believe as the supplies goes up, and the people will not have much choice in the US. You have only 2 vaccines here. In the UK, only have Oxford vaccine. In other countries, China and India and Russia, they have their own vaccine. So we don't have much choice actually to be picking up vaccines here and there. But I agree that at the end of the day, hopefully people will talk about only COVID-19 vaccine, irrespective of the producers, if the effectiveness is 95%. If you want someone here to get a vaccine that is 70%, people will question you that no, I already have option of taking a vaccine which is 95% effective and is better, but a vaccine is better than no vaccine.
Thank you so much. Our next question comes from Mr. Mahmoud Hassan from Dallas, Texas. And this is the question for Dr. Masud Rahman, Khandakar Masud Rahman. The question is, zinc isn't as readily available over the counter as vitamin C or D. Are multivitamins good alternatives?
Yes, as long as, can you hear me? I think you can hear me. Right?
Yes, we can hear you.
It's a good thing many people are taking, as long as there is about 1,000 units of vitamin D, about 1,000 milligram of vitamin C, about 30 milligram of zinc. It could be 40, 50. The different preparations are there. You can take it over the counter. And we are taking it over the counter. It's not a problem.
Okay, thank you. The next question comes from Tariq Khan. He had two questions, but one of them, I think we already answered, which is after vaccination, how long the immunity will sustain. So the answer was, I believe, we do not know, but I think it's 2 years. But the other question was, Firoz Bhai, if you could answer that, Dr. Abu Said Firoz, can we use CPAP machine for breathing issue in home?
You know, first to answer, you can hear me, am I right?
We can hear you, please go ahead.
Okay, please look at the chat answers. I have answered all the questions in the chat as much as I could. So this question was answered. The CPAP is called continuous positive airway pressure. It is a machine which people use for sleep apnea, just to make everybody understand. Now, what happened when the thing COVID-19 came first to the United States in New York, you know, we were told don't use the CPAP. You know, it caused viral dispersion, and you know, a lot of people will get infected in the hospital. Everybody is going to die. And we quickly, what they did in New York is they intubated everybody, and 60% of the patients died. So now we have learned not to intubate the patient and use CPAP. To answer the question, a lot of people have sleep apnea and use CPAP at home. They can use the CPAP if they don't have COVID. You know, it's fine. If you suspect that you're having symptoms of COVID or you have COVID, it is better to stay in a separate room and use the CPAP. Because if your wife isn't sleeping in the same room and you have a chance of COVID, there's a little bit risk of viral dispersion or spreading. Thank you.
Thank you. The next question comes from Mr. Firoz from New Jersey. I think he had two questions. This is one of them, which is, what are the contraindications to getting a COVID-19 vaccine? Firoz Bhai, you can answer it. If you want to pass it on, I can also ask Masood Bhai to answer this.
You know, I'm going to take the first shot. Let me take a first shot at the vaccine. First is, you know, most of the vaccine material are safe. The things that they use to preserve the vaccine, one thing is called PEG, polyethylene glycol. And those are the things that you react to. So in general, you know, if you're allergic to other medications, then there might be a chance of, you know, getting reaction to this medication. I will pass it on to Masood for the rest of the thing. Most of the time it is safe. You know, the PEG is a thing that most of the people react to. It's not the vaccine material. Thank you.
Yeah, at present, the thing is like this, Firoz has told it mostly. One is, if one is thinking to get pregnant in next 2-3 months or pregnant, they're asked, the recommendation is not to take the vaccine now. The other is those who are having severe anaphylactic reactions at different phases of their life. They already have EpiPen in their pocket generally. They should not leave the place after the vaccine. It's not contraindication. It has to be very, very much careful. Very much careful, because the treatment can be done over there. And the other thing, those who are immunosuppressed, like the patients of kidney transplant has been done, and they probably still the recommendation is, it's not a direct contraindication that I don't know if Firoz Bhai can confirm and correct me. It's a recommendation for them not yet to take the vaccines. So those are the few things. Only allergy, as you said, polyethylene glycol. That's the part of the lipid which covers the mRNA. The lipid is cholesterol and PEG or polyethylene. Only PEG is sensitive. Other things in that is sucrose and salt. They don't cause the, what do you call it, the reactions. So these are the people may have reactions. Now you can ask still the board, or my elder brother Firoz Bhai can still say what else is there.
Well, I would say that, you know, you all know that, or everybody knows that the vaccines are not recommended for children. These vaccines are for 16 or 18 years older people. So that's the only thing that they should not get it right now until the RCT study confirms about the suitability of the vaccine to children.
Thank you. Next question came from two persons, one from Bangladesh and one from Austin. Mr. Zahir from Bangladesh and Mr. Mamtaz from Austin, Texas. They had the same question, kind of similar, not exactly, but similar, which is those who are willing to prescribe ivermectin as a precautionary, like a preventive measure, what dosage would you recommend? Dr. Mizan Siddiqui and Dr. Firoz, if you could kindly go ahead and answer.
Do you want me to answer this?
Yeah, Firoz bhai, please go ahead. You can answer.
Okay. So the use of ivermectin, is not guided by, randomized controlled trial. So this is, if you look, when you get a chance, look at the WHO Solidarity Trial. It's called Solidarity Trial, WHO Solidarity Trial. There they address all the medications. So ivermectin, a lot of things we don't know. I think ivermectin has been used more in Bangladesh than United States. The recommendation in the Solidarity Trial and also the thing that the doctors use in this country is called medical up to date. Their recommendation is not to use the ivermectin beyond a clinical trial because there is no randomized. There's one study which has been published and the quality of data is poor because there are confounding factors. What happened, they used the ivermectin along with the steroids. So we do not know whether the ivermectin made the difference or the steroid made the difference. I cannot give you a dose to take. And as I told you, according to the randomized controlled trial and our practice in the United States, there is no medication we use to prevent COVID-19. We just don't have it, except for the vitamins and all that you talk about. And those are not proven by the randomized controlled trial. So I couldn't give you the dose of ivermectin. There is no good study by a randomized controlled trial to show it works. And that does not mean that doesn't mean it doesn't work. I don't know.
I can tell you about the practice what is being in Bangladesh, not in America. In Bangladesh, ivermectin has been given to different places and it has worked in many places. Well, that doesn't mean that it is working everywhere. We don't have a randomized controlled trial, that's true. But ivermectin is being used and those who are willing to use it, the dose is 200 microgram per kilogram or 0.2 milligram per kilogram. A 70 kg man or a woman will take 14 milligrams of the tablet. Each tablet is 6 milligrams, so 2.5 tablets about. That is how those who are willing to take despite all the informations, it's fine. There's 200 micrograms or 0.2 milligrams per kilogram. Thank you.
I would add that there is...
go ahead.
Sorry. ICDRB did a study on the ivermectin and they did not find any significant difference. So, and it was not a true double-blind randomized controlled trial. Another study came up from India. They actually used among the health workers as a prophylaxis. And they found out significant difference, those who received as a prophylaxis compared to those who did not, that they were protected from COVID. So these are the two studies that came up. But as Dr. Firoz mentioned that in the US, this is not a recommended regime, and WHO has yet to recommend it if they find a good RCT findings.
Thank you. Akhtar bhai, you wanted to say, please take a few seconds. We have many more questions.
Regarding ivermectin?
Yes. Okay, skip then, I guess.
Then skip it, yeah.
Okay, so next question also comes from Austin, Texas, which is for Dr. Mizan Siddiqui. Can you kindly let us know what is the status in Bangladesh on vaccine?
Well, Bangladesh has a struck deal with COVAX. So if COVAX get the vaccine, Bangladesh will get it. Bangladesh also has struck a deal with India. I think it's the only country that India has agreed to give a vaccine outside their population. So these are the two information that we have. Bangladesh is trying to have Oxford vaccine also. They are trying to make a deal with the company there to procure some more vaccines from Oxford. The China one who wanted to do the clinical trial there did not work out. And I guess it's all at diplomatic level. Things are still going on.
Can I ask a question to Dr. Siddiqui? One thing is Gavi, the Global Association for the Vaccination and Immunization. They also are they planning to give vaccine in Bangladesh about 30% of the population? That's what I heard.
No, that's about 20% population. They will give to all the countries that have signed up, about 92 countries, and they have $2.4 billion already in them. The question will come up whether the supply will be available even if you pay them. But the interesting thing in the vaccine is that vaccine producers would like to have ensured market before they go into production. So that's why the international facility, COVAX facility, has ensured them that we have $2.4 billion to procure vaccines. So you continue producing them. And if the countries request them, then that money will be made available to provide them at least up to 20% of their population. But Bangladesh is a middle income country now. They have money, they can buy.
Thank you. We're going to the next question.
Stalin, if you can, sorry for interrupt. I have to quit.
Yeah, sorry, Mudassir bhai, you have to wait for 1 minute. I have two more questions.
Okay, just for 1 minute, because I have this, I would like to leave. I have to quit for some other place.
Yeah, please, it's coming up. Just 1 more minute.
Okay.
Last question on the Q&A, which came from, is it safe to assume that all vaccines are safe, even if some of those may not be effective deterrent to COVID? Firoz bhai, please.
You know, can you hear me?
Yes, go ahead.
Okay, there is a website. It is free for everybody. You can log it from anywhere in the world. And the journal is called New England Journal of Medicine. That is the most prestigious, journal in the United States, in terms of medicine. So nejm.org and type COVID vaccines. When you talk about vaccines, there are two things you should consider: the efficacy and safety. See, most of the time in the Western world, everything goes through a randomized controlled trial. So suppose if you're talking about the Bharat vaccine or the Indian vaccine or the Sinovac, just go into New England Journal of Medicine and see what are they telling. It is a free website. So in general, the vaccines are safe. And what a dreadful disease COVID-19 is. So I would take the vaccine. I have taken it. But if you have any questions about a particular vaccine, you can go to nejm.org and type COVID-19. You don't need a subscription. It will guide you. Thank you.
Thank you, Firoz bhai. I think we have a lot more questions in the chat box, but here we'll pause. Question from the chat box, the email, and the text. We'll move on to one-on-one question. In the one-on-one, what we do is basically, if somebody has a question, you can either click raise your hand or just show your hand, either one, and then you can talk to the guest one-on-one. So I saw that Muazzam bhai had the first hand since like half an hour, and Mudassir bhai wants to rush and go out because he has to go somewhere. So my question to Muazzam bhai, can he go before you?
Do you want to get me an extra drill? Why do you have to ask this?
Thank you so much. That's what I was hoping for. Mudassir bhai, please go ahead. Thank you. Please ask your question to a specific doctor if you can. Otherwise, we wouldn't know who you're asking to. Thank you. Please go ahead.
First of all, Muazzam, forgive me for intervening. And at this stage, I have no intention to give you the extra deal. Neither do you have the capability of carrying it out. All right. Now, I was engraved absolutely. It's a fascinating discussion. I enjoyed everybody, not being a professional, and I'm sure everyone had enjoyed it fully. Now, I have a couple of questions. I do not know exactly whom to ask, so I leave it to the floor and for Stalin to decide or the doctor themselves decide to answer. Very general type questions. One is as we understand, the medical science is a continuously changing a science. My question is, what you find true today may be untrue tomorrow. So that is one question which is everyone's mind. Why I'm asking this particularly is that although you have talked about the efficacy of the scientific in detail, Dr. Siddiqui and Firoz particularly and other doctors, as far as Bangladesh is concerned, third world country, in particular I'm interested in Bangladesh. Bangladesh and Manus, we know that particularly তোমরা সবাই জানো North Bengal, especially গ্রামেগঞ্জে মফস্বলে, we are told that majority of them they are not bothered about COVID এবং কোভিডে কোনো প্রকোপ এখানে দেখা যায় না। অনেকে জানে, আমি আমার আত্মীয়স্বজনের সাথে আলাপ করেছি, তারা বলে they do not have any case of COVID patients either at home or in the hospital. So, but then having said that, we do not know when it is going to surge again. এবং তারপর hesitancy শহরের লোকদের মধ্যে আছে। So I would, how do you convince these people? Of course, you have said some points. I want in particular Bangladesh third world, how do you convince them? No, it is safe, go ahead and do it. And could we do something like that? I mean, particularly Akhtar ke bolbo, Akhtar often goes to Bangladesh, plus Masudur Rahman ke bolbo, Firoz কতদিন পর পর যাওয়া বাস ডক্টর জানি না যে আমরা এরকম কিছু করতে পারি একটা sort of do's and don'ts অথবা নির্দেশনামা পয়েন্টস বাংলাতে লিখে দিয়ে ছড়িয়ে দেওয়ার জন্য গ্রামে গঞ্জে মানুষের কাছে যে just to take out the fear from the mind, no, it is good, go ahead and take it. এইটা একটা হচ্ছে আমার প্রথম প্রশ্ন। এক সেকেন্ড প্রশ্ন হচ্ছে AstraZeneca, you said 90 to 95% efficacy is good, but then I hear, if I'm not wrong, Dr. Siddiqui Hiso mentioned that AstraZeneca is a vaccine where the efficacy is 60 to 65%. Then if it is 60 to 65%, do we go for that? We should try and prefer to some other vaccine. I know the options are not in our hand. It is an option rise to the government, on the ruling government, wherever country is. So should we go for that? This is the second question. Probably for Dr. Siddiqui or Farouz. Third হচ্ছে এটা আমার তোমরা অনেকে শুনেছো কিনা জানি না, আমি কিছুদিন আগে ডক্টর ইউনিসের একটা ইন্টারভিউ শুনেছিলাম which was conducted by Al Jazeera, and where apparently he is also a member of the WHO or United Nations COVID initiative. তোমরাকে প্রশ্ন করা হয়েছিল বাংলাদেশের অবস্থা সম্বন্ধে, উনি বলেছিলেন যে I'm scared of few things. One is most of the pharmaceutical companies, the places their origin from, as one of you have mentioned, Dr. Siddiqui Rafidami Jaina, that what you recommend is a particular a billion of doses, but you are keeping in stock few times more, 3 times, 4 times more. So by the time it comes back to countries like Bangladesh, it will be too late. We would have suffered more casualties, more fatalities. One. Second, উনি বললেন যে আরেকটা স্ক্যার which is very alarming, আমার কিছু স্ক্যারি মনে হচ্ছে, উনি বলেছেন যে দেরি হলে what is going to happen, patients might have fake vaccines. বাংলাদেশের মতো দেশে, both within and outside the country, we have seen the corruption, mishandling with mask and other ventilating machines. COVID tested result কি হয়েছে, so the vaccine যে 2 নম্বর বের হবে না তার কোনো নিশ্চয়তা নাই. So what he said, we suggested this, I urge upon these manufacturers to give up the patent right. আমাদের মতো থার্ড ওয়ার্ল্ড কান্ট্রিতে যারা those have developed the facilities to produce, আমাদের কাছে ট্রান্সফার করে so that আমাদের এটার জন্য সহজলভ্য হয় এবং পয়সার দিক থেকে কম পয়সা লাগে. So how
I'm sorry to pause you.
I'm just finished with one more question, and then I'll give up.
Yeah, because with due respect, we have to address many other questions. So
just one more question.
Thank you.
Just one more, I'll give it up. সেটা হচ্ছে চাইনিজের ব্যাপারে আমার যেটা সাজেশন, মাসুদ না চাইনিজে চাঁদিকে কথা বললো মাসুদ, মাসুদের করছে হচ্ছে মাসুদ, we are absolutely fascinated the way this Chinese government handle. How much effort have you taken to give this experience and knowledge and expertise to Bangladesh to benefit our country? So these are the all questions I have. Over to you.
Okay, thank you. Mudassir bhai, thank you for all the good questions, but at the same time, we want to be respectful for everybody's time because a lot of other people are waiting.
Absolutely, I'm sorry about that.
I know you had 4 questions, and then it would be much easier if you came back again for the next question. But I'll ask Masudur Rahman from Beijing to answer Mudassir bhai's question, and then we'll go to somebody else.
No problem.
Okay,
go ahead.
Thank you, Mudassir bhai, for the question. With respect to the excellent state-of-the-art solution to fight the COVID-19 virus, the medical terminologies from prevention to treatment to all facets have they have given regular briefings, not only to Bangladesh, but actually it is open for all the embassies and all the international community. So we have from time to time fed this thing to our health directorate under the Ministry of Health and also IEDCR. Also, we collaborated and we had taken that health technical team from China, which are under National Health Commission of China. And it is a rare thing that we could take them because usually China does take it to Myanmar, Pakistan, or countries like that. But it is a one step forward that China took it to Bangladesh. And another aspect is that during the COVID time, President Xi Jinping had a phone call with our Honorable Prime Minister and held talks for 50 minutes, which is a testimony to the kind of friendship that we have been developing with China. And he mentioned that, Mr. Xi Jinping mentioned that China would stand by Bangladesh not only in the fight against COVID, but also in the economic recovery. In fact, today Bangladesh has posted a remarkable economic growth, and we can only thank the Chinese government's initiative. The flight between Bangladesh and China never suspended, for your kind information. It actually, every week there is a flight. At present, there is no direct flight between India and China. And the Indian ambassador in Beijing, he sometimes even he lamented before me as well, given the relations. So we have taken it very positively. Besides, there are good air cargo moving. Also, the trade between Bangladesh and China is also on the rise. During the COVID, the Chinese entrepreneurs are trying to relocate their businesses in Bangladesh, probably targeting the Asian countries. And actually, there is we have reported about 700 millions of US dollars of investment through our embassy. And there is also direct communication with certain Bangladeshi companies as well as Beza and others. There is also a huge development in the area of collaboration with China for IT sector as well as.
Masood, sorry for interruption. In fact, I was putting emphasis on the transfer of the knowledge and experience and fight tackling COVID-19 vaccine. We don't see much of result. So how are you doing to translate that experience into Bangladesh?
In other words, the high-tech softwares embedded in the 5G and artificial intelligence and cloud computing cannot be translated not only in Bangladesh, but many other parts of the world because, China has the largest number of closed circuit cameras which are connected with the big data. If I come out from my room, I am under the camera and they know where exactly I'm moving. So it is not replicable. What China has done is a miracle and you cannot replicate it. In fact, that is the case.
I understand that. But then China experienced that was my question. Anyway, thank you, Masood. Thank you.
Okay, thank you. I think, Mudassir bhai, you had at least 4 questions. I lost track of it. That's why I suggest one by one. So Dr. Siddiqui, I think he also had one question for you. I actually forgot. What did he ask? But do you remember? He asked you a question. If you could kindly answer that.
Well, I think he was asking one question in terms of the immunization coverage in a vaccine hesitancy situation. Bangladesh had remarkable progress in immunization, universal coverage immunization. It was a miracle. And then again, Bangladesh also eradicated polio before everyone in the region. So I think the Ministry of Health and the IEDCR has lots of experience how to handle through advocacy, media, and many other communication channels. In terms of the efficacy, the FDA has said that they will approve vaccine if it is 50% and above. So the idea is that anything in between 50 and 90 or 100% would be a candidate for recommending any vaccine. So it's like influenza vaccine as well. So I would say that the idea is that how to create immunity and protect people is one of the tools of prevention of the COVID-19. So whatever be the efficacy rate and availability will dictate that whether you should take it or not. But everybody should take the vaccine, no matter what is the efficacy, if it is about 50%.
But Dr. Siddiq,
okay, thank you, Mudassir Bhai. I'm sorry, we have other people who had questions. If you don't mind, we have a lot of questions. So yeah, we want to be respectful everybody's time. I have at least another 10 questions on the chat session. So with that, next is Mojem Bhai. I know you're waiting for half an hour. Kindly, please go ahead.
Thank you very much. I'll be very quick, but definitely if Mudassir Bhai continues, we will all be quiet and happy to listen. My quick question is, one question is to Mizan Siddiq Bhai about the herd immunity. I know in measles and polio, we are trying to achieve, and we have been struggling for decades. So what will be the critical coverage level across the globe or in a particular country when we can say that we have a herd immunity? In particular, in measles or in polio or another, we have a target group that we massively, uniformly vaccinate everybody, but COVID is going to be targeted in a target group, like the health workers and then the secondary, and then, so ultimately when the whole country or the world will have that coverage, when we can say that COVID, we have the herd immunity. And I have a quick comment, Sohail. One is, I will take with Masood politically about China not allowing WHO for investigation, but in order to just complement that, one is the developed world is not helping enough the developing country, and the other one is developing countries are not learning from them as well. We could learn from China that we could be a leadership under the prime minister or the president, what China has done, and make a uniform decision. We see our prime minister making small things, making decisions on the COVID. There was a total lack of leadership, so we didn't learn. We have Dhaka Stadium, we could turn into an hospital, we did not. On the other hand, I'm living in US now. I have gone to Bangladesh. I have lived in Jordan. I think US public health system is a total mess and a shame to the world that I can't get a COVID test result 5 days. I changed my flight twice and I could not get the result. Whereas in Jordan and in other countries, I could get it in 48 hours time. So that I see, and then I have been quarantined for 10 days for my COVID positive, and my children are exposed to me. They are being quarantined for 21 days and they're not allowed to get out. I just don't understand, and they're arguing and they're embargoing, police is coming. So this is a absolutely catastrophic public health system to me. So sometimes we don't see what we want to see in the developed world, and sometimes we have good examples we don't learn. Thank you very much. Over.
Okay, Dr. Siddiqui, kindly go ahead. Mojem, I had a question directly to you. Please unmute yourself.
All right. As you saw, that Dr. Fauci, the main spokesperson in this country, recommended about 85% for herd immunity. Herd immunity is calculated using the R-naught. The R-naught for COVID-19 is around 2.5. So herd immunity is calculated by 1 minus divided by 1 by R-naught, which gives you the about 60% to 70% as the basis for the herd immunity. But there are many other factors in terms of the herd immunity, transmission rate, how close contacts you are, what kind of population are we talking about. Children are not yet covered. So getting the full herd immunity, you need to cover the entire population, about 80 to 85% for COVID-19 for now, whatever information we have. But definitely informations are coming out when the vaccines are rolling out in different countries.
So we will have to wait.
Thank you. Two more quick questions. One came from Tariq Khan, Austin, Texas. And this goes to Firoz Bhai, Dr. Abu Said Firoz. Can we take as a precaution any blood thinner like 81 milligram aspirin?
You know, as I said, COVID comes in mild, moderate, and severe disease. And COVID is associated with a phenomenon that we have term called endotheliitis, inflammation of the blood vessels, and thromboinflammation, So most of the people who die of COVID-19 infection usually, die of lung disease or blood clots. Now, once you're in the hospital, you have severe disease, then you have to take something stronger than aspirin. We usually use oral medications, it's called, we use epaxiban, and other medications. But if you have less severe disease that you are outside the hospital, most of them will not need anticoagulation. I think it is okay to take the aspirin with mild disease because the blood clots depend on the severity of infection. And as the inflammatory marker goes up, your chances of getting a blood clot increases. So if you are admitted to a hospital regular bed, that means you're not that sick, we don't provide, high dose of anticoagulation. But, if you are admitted to the intensive care unit, you have been on a ventilator and you have been discharged home, you have to take not aspirin, higher than that. We use, a medication called Xarelto or epaxiban for at least 4 weeks. But, if you're asymptomatic outside, I think it's okay to take aspirin.
Thank you, Firoz Bhai. The next question comes from Mr. Momtaz Karim. He's from FCC and a very senior cadet. And he goes to Dr. Siddiqui. I understand UNICEF in Bangladesh is, as usual, the primary procurement agent for COVID vaccine. Hence, what is the role of Beximco that we hear about? Dr. Siddiqui.
All right, UNICEF is also part of the WHO alliance as well. So UNICEF role is very limited. First of all, UNICEF tries to negotiate with the companies to reduce the price of the vaccine, that they have been doing it for many vaccines in many countries. So UNICEF has an added advantage because they give the order, they have the money, and then money is usually taken from World Bank or Bill Gates Foundation or others to support that. So they have a market that they ensure by making sure that the companies are not going to lose money. So UNICEF role is limited only in terms of procurement, but they did an excellent job worldwide with any vaccine, you can say. And here they will also play the same role. And their overhead for procurement is also extremely low. So if there is a public-private partnership and the international partnership, the prices can go down as well. Also in terms of transportation, maintaining the cold chain and so on, UNICEF is the leader in that. So UNICEF must be engaged into procurement process, but they will play one part of the role.
Yeah, that's what my question was. Sorry, Dr. Siddiqui, because I know that UNICEF staff members, they are all terribly bogged down with this particular procurement now. It's a huge thing. But we hear about Beximco. I mean, why Beximco has been brought in the picture? That's what I wanted to know, because from the news media, it's not very clear. We just hear that Beximco is in there, as if Beximco is doing all the legwork for the government. And that's what I wanted to know.
Okay, now interestingly, Beximco produced the remdesivir. You all know that. And remdesivir came to even to US from Beximco, which is an excellent thing happened as well. But Beximco or anyone else does not have the capacity for the vaccine that we are talking about. India produces 60% of the world vaccine. The Indian Serum Institute has taken a contract for many of them, even then they are not able to supply them. So Bangladesh does not have the capacity of production of vaccine, and Beximco does not have that facility or the expertise to produce vaccine. And the patent, will not be probably given out in near future because most of the companies have vested interest to make money out of this vaccine over a long period of time.
Thank you, Dr. Siddiqui. I have a few things before there might be a few more questions.
Yeah, Stalin, I had one short question since you gave
Please
me
go ahead.
Is, we get a lot of information about how to sanitize day-to-day product like, groceries and vegetables, etc. I personally, find it extremely difficult to handle it. I have not come out with any any good practice. So I want to know from the medical people that people are handling, and if you can give us some advice about good practice that we should do, and also
can you kindly choose someone that can answer your question?
I don't know, because I don't know individually some of you, but if
anyone raising hand to answer this question?
Dr. Firoz might probably be able to help.
Okay, Firoz bhai, please. Unmute, please.
Can you hear me?
Yes.
Yes.
Today there have been very few reports of the spread of COVID-19 through the mail, through the groceries and all. except for the salmon fish that I just heard from China. And I don't know what they're doing in China to prevent that, So in general, it's a good practice. Most of us, we end up cooking our food and all this. And the only thing in the vegetables that you get, you need to wash them thoroughly. And of course, we do the cooking and all this. So in my home, I don't take any extra precaution. And there has been no clear guidelines from the CDC. And most of the time, the milks and groceries and all has known to spread the COVID-19 vaccine, except for the salmon that I heard from China. Thank you.
আমি একটা follow up question করি
one second let me just clear the link. What I mean to say that as you bring grocery from the shop, from whatever groceries like cauliflower, cucumbers, a lot of other things, you cannot wash them before you use them. So if we are keeping them in the fridge as you bring, is it okay? That's what is my concern. At the beginning, we used to put, Lysol and other things on the vegetables or try to wash them and put them. You can do it once or twice, but not on a regular basis. That was my concern, that when I tell my children or my relative, I myself get confused. I say, am I telling them the right thing or I'm just overdoing it?
I wouldn't use Lysol or I wouldn't use any disinfectant or anything, And most of us, we end up cooking the, cauliflower and all this, So I think it should be safe to take. If anybody else wants to add, Akhtar,
go ahead. You wanted to say something.
Yeah, the question is the storage. If we keep them in the store for a few days, does it contaminate the storage, the fridge, or the people who are handling the refrigerator, etc.?
No such report has been yet found, Mumtaz Bhai. No such report has been found. And I am with Firoz Bhai that when we cook properly, wash and cook, after you bring it out of the fridge, should not, so far, there is no report of contamination other than what we have heard few minutes.
Thank you very much. Okay.
আচ্ছা আমি একটা কাইন্ডলি একটা ফলো আপ কোশ্চেন করি এখানে আমি কোশ্চেনটা অনেকক্ষণ ধরে করতেছিলাম থ্যাংক ইউ মমতাজ ভাই আপনি যে কোশ্চেনটা করছেন সেটা আমি একটু ফলো আপ করি এই যে ফ্রেশ ভেজিটেবল আমরা যে জানি যে সারফেসের উপরে থাকতে পারে কোভিড-19 এর তো আমি যদি ফ্রেশ ফ্রুটস কিনি সেটা যদি 24 আওয়ার রেখে দেই তাহলে কি এটা ক্লিন মানে জাস্ট নরমাল ধুয়ে খাওয়া যাবে কিনা এটা একটা কোশ্চেন আরেকটা কোশ্চেন হচ্ছে যদি কোনো ফাস্ট বা যে কোনো ফুড কিনি আমরা বাইরে থেকে সেটা যদি 30 সেকেন্ড মাইক্রোওয়েভ করি তাহলে কি এটা কি is going to be free of COVID-19? That's these two questions I have.
Who do you want to answer this? Any volunteers for this question?
I don't know the effect of microwave on COVID, so I can't answer that, কিন্তু আমার মনে হয় যে once you wash the things and keep a few days of refrigerated, you should be able to eat. এখন পর্যন্ত কোনো রিপোর্ট পাওয়া যায়নি আপনার যে COVID-19 ফুড দিয়ে স্প্রেড হচ্ছে. So I think inshallah we are safe with that. I don't know the effect of microwave on COVID-19.
Thank you, Akhtar bhai. Please go ahead.
Same case with me. You see this, আমরা যে 20 seconds হাত ধোয়ার কথা বলি, it takes out the virus at least. এই হাত ধোয়ার একইভাবে যদি আমরা 40 seconds একটু বেশি সময় ধরে ধুলাম ইয়েগুলি ভেজিটেবল গুলি, then we should not have any problem, and we are yet to hear anything, any problem.
Thank you, Masood bhai. Akhtar bhai, please, you wanted to say something. Go ahead, please.
No, regarding this, I can only say that initially there was news or informations that if you mail and the food, you got to clean it properly because you are not the one who is touching it. The postman is touching the mail. He could be COVID positive and he can transmit this. And also in the shops, grocery shops, there are other people, food handlers, they can transmit it. So it's a good habit to bring it home and then wash it properly. I don't mean not with Lysol, but wash it properly and then cook. I think I have answered that, but I have two questions for Firoz. This is about the NAC, the N-acetylcysteine. For years have been used for lingering symptoms of influenza A. In a recent discussion, it was for the long COVID-19. Can this be a drug of choice where you use 600 milligram capsule a daily. Have you come across that?
Akhtar, I don't have any information about the use of N-acetylcysteine on long-term COVID, and we are not using it, but I'll look into the literature. If I find anything, I'll let you know.
Another question I have it is yet unanswered. In Bangladesh, I hear people, especially, one of our cadets' mom, she has been COVID positive, but every time she tests, she is getting it positive after positive. What is the answer to that?
My feeling about that, even if she tests positive, most of the time, majority of the people who test positive, some people may take a longer time to clear, the antigen away, but most of the time they are not infective. So they are not going to cause the spread of the disease, and, there have been now reports of some reinfections also, though not particularly, a large number, a few anecdotal reports have come out, but majority of the time you can test for the antigen, but most of the time you're not infective.
Thank you.
With that, we will have, I think, we're almost coming to the end. It's very hard to answer all the questions, but a few things we're gonna do next, which is I will draw the conclusion. Still, you will have enough time to talk to one-on-one after we stop the recording. You can talk to one-on-one and, we can go more, but I'll start drawing the conclusion. I'll request all the doctors that participated as a guest speaker today, if you could prepare a 30 seconds, last few things that you want to say to everyone while I draw the conclusion. So let me congratulate all our doctors who volunteered. And I want to repeat again, they volunteered their precious time to make this program successful. Thank you. Thank you for all the attendees.
Give a clap.
Thank you for the attendees who joined us from all parts of the world. Please join us again when you see us on the road with a different topic. We'd like to hear from you. If you are a subject matter specialist, I would welcome you. Kindly contact me so we can arrange a talk like that would benefit others. Like I said, our doctors are a volunteer for you here. And if you have any circumstances with COVID or any others, kindly speak to your physician and they can give you the right benefit. We are here to give you and bring you as much information that we can provide. Also avoid misinformation that you're hearing from left and right. So hopefully this was helpful to you. Now we are going to hear from the doctors who participated. Akhtar Bhai, first you, 30 seconds. Dr.
Lely, but spelling sorry, I have to beg your leave. Thank you very much for organizing an excellent discussion and wish you all the best. Thanks to the doctor. Thank you. Assalamu alaikum.
Thank you so much. Go ahead, Akhtar Bhai, 30 seconds.
Sir Bhai, I invite you for 30th January. You are leaving.
30th January.
30th January, the invitation. I'll tell you. You'll get a Zoom. Be a cadet college.
Mahmoud Bhai, sorry, we are on a recording right now.
We'll talk to you.
Masood Bhai, we're on a recording, so please hang in there 1 second. Akhtar Bhai, please go ahead.
Thank you.
30 seconds if you want to have any advice for our audience.
Okay, what I can tell you that my friend Firoz has been helping a lot of COVID patients amongst our ex-cadets, their families, and even me and my wife. So with gratitude, I thank him. And if you need his help, he's always there. So don't hesitate to call him regarding this. The other thing I should say that I thank all the participants. One of the speaker, Siddiqui, who is from my medical college, I know him well. So for his participation as well. And thank you, everybody. It was an excellent session. We all have enjoyed it. And thank you, Stalin, for organizing it. Thank you.
Thank you, Akhtar Bhai. Next, Masood Bhai, please go ahead, 30 seconds.
Assalamu alaikum. Thanks to everybody. Once again, my words will be take home. Please keep on using mask. Please maintain social distance. Don't make parties at your home. You think that I will not be affected. Everybody is affected. It's fine. You believe it, but you think you will not be affected. Don't do that, please. Do not do parties at your home. Number two. Number three is wash your hands as usual, and take the vaccine. Please take the vaccine and call us. You can call Firoz Bhai, you can call me, you can call Akhtar, anybody who we intend to help as much as we can. And my last thing is on January 30th, I take a chance to tell here that on January 30th, there'll be a Zoom meeting, Zoom, Iranian type, all cadet colleges, 10 cadet colleges together. I'll send you, please join, please join. Thank you.
Thank you, Masood Bhai. Masood Rahman from Beijing, 30 seconds. Would you like to say anything?
Unlock karo. Tom password dao.
Sorry, kindly mute, please. Masood Rahman, please go ahead.
Mute.
Masood Rahman from Beijing, are you available? Okay, we are moving on to Dr. Siddiqui. 30 seconds, please go ahead.
Thank yes, you, Sohail.
Masood, we'll come back to you. I'm sorry. Dr. Siddiqui, kindly, I'm sorry. Go ahead, please.
All right. Sorry, Masood. Thank you, Stalin, for organizing such a wonderful event. And I'm glad to meet you all, very leaders and experts in this area. And my only message is that, promote vaccination. Thank you all and see you soon.
Thank you, Dr. Siddiqui. Masood Rahman, please go ahead. Please, 30 seconds. You have to unmute yourself.
Yeah, actually, this is a very difficult time for all of us. And we are not sure as of how long the vaccine can keep you afloat from the dangers beneath. So it is important to curb the spread of the virus. We have to do the basics. I think the Chinese concept lying is based on this fear that even in case the vaccine doesn't really work. So that is the basic premise. So, but with big hopes that taking cue from the 1918 pandemic, it was there for 3 years. The second wave could be the most fatal. And then later on in the third and fourth successive wave, because of the strains and genetic sequencing, it may get weaker. So let's hope for the best. Let's hope for all the best, and we should remain alert and vigilant. Thank you.
Thank you, Mr. Masood, for joining all the way from Beijing. I know it's late at night over there for you. Dr. Jahid Hassan, he's also a doctor among us, and he's working. Dr. Jahid Hassan, would you like to say anything? Jahid bhai?
He's driving. Back, so I actually worked all day today, but I did listen to the important lectures, especially most of Firoz Bhai's lecture I heard, but I joined later on to hear a little bit from Dr. Siddiq and a little bit of Masood Khandukarcha, Bhai. So anyway, for me as a burn and plastic surgeon, it's like affected the practice as a whole, but there is no skin manifestation for COVID yet. So we don't know whether it's going to have any. So far, everything looks okay, and I'm staying safe. And please, everybody stay safe. I took my vaccine, and I strongly recommend everybody to take the vaccine, even though there are some, concern about it. But for like everything, there will be concern. But I think, we need to all convince ourselves to get the vaccinated done. Thank you very much for arranging this. This was really a good session, but unfortunately, like I said, I joined partly. Thank you so much again.
Thank you, Dr. Jahid Hassan. He's joining from Georgia. As you know, the election went on a few days ago. Now, Rizal Bhai, are you here? Our heart specialist, cardiovascular specialist. I guess he's not. Okay, so last 30 seconds to Dr. Abu Said Firoz. Please go ahead.
let me thank all of you for joining this. So what we discussed today, in the next meeting, I don't know, will be 3 months, we may talk completely different. The biggest thing we know about COVID-19 is we don't know anything about it, because the randomized control trial keep on changing, and we have to change our guidelines. So at least go to the CDC website, see what they're recommending. My only concern is that the misinformation and unproven medications may create problem. Again, the vaccines, I told you that my whole family member, everybody, has taken it. We are waiting for my wife to qualify for the vaccine. I would strongly urge all of you to take the vaccine. And thank you very much for listening to me and providing your time.
Sohail, I bring to your attention, Sohail.
Thank you, Feroz Bhai. Akhtar Bhai, yes, go ahead, please.
I bring to your attention that one of our ex-cadet, Anwar, he has been very sick, but I see him on the screen whole time with all eagerness and patience. I must have to appreciate him.
Correct, and let me tell you who are still here. Mr. Anwar from London, he is COVID positive. He was in the hospital and he's a survivor and is still positive. So he's still fighting. He has been in hospital at least twice. So thank you for coming here. We do appreciate your time. And Dr. Muazzem, who also works in UNICEF, currently is in New York. He's also tested positive. I think still he's positive, and he's also fighting COVID like a champion. What I will do right now, thank you all. I'll stop the recording, and we still can do our Hangout and Adda as we do. And then we all can talk to each other. So thank you all again. Assalamu alaikum. Thank you so much. I'm going to stop the recording, and then you can talk to each other.
One information, একটা information আছে সবার জন্য। আমাদের যাদের relative আছে in Bangladesh, they will definitely, inshallah, get their vaccines as Bangladesh plans to give it. But remember one thing, let me give you this information. Nasir Shahriar Jahid of our batch is owner of Radiant Pharmaceuticals, and he's a very efficient guy in all sorts of government policy implementations and others. I had a talk with him. He has already got the sole distributionship from Sputnik 5, which is Russian vaccine. He was fighting for the Pfizer. Pfizer was talking to the government. Pfizer has told him, the government should negotiate na korte parle, o jodi sufficient price দেয়, Pfizer will give vaccines to him for the urban areas. So আমার মনে হয় আমাদের যাদের কোনো দরকার যদি হয়, our friend Nasir Shahriar Jahid has ever been helpful. Anybody knows, everybody knows. He will be helping. Please keep this message. I told this because I had a talk with him. So he will be able to help. পাচ্ছে না কোনোভাবেই দরকার. Probably Nasir Shahriar Jahid will be the man in our country. We're proud. He's also from JCC and my batch. So he will be doing. Once again, I agree with Akhtar Bhai. Anwar, love you, boy. I've not seen you, but the tenacity and everything, we love you. Thank you.
Thank you. We're not going away. We are going to stop the recording and then we can talk to each other. Just a second, please.